Track 6. This track is approximately 97 minutes long. Chapter 5. Health, configured for treatment, not participation. 417. Health is no longer a background factor in youth disengagement. It is central. Ill health is now a primary driver of who becomes neat and who stays neat. Note 445. Not working. Resolution Foundation. www.resolutionfoundation.org. Published June 2020. Available at https://www.resolutionfoundation.org/publications/not-working/. And the text continues. For the first time in perhaps 2 centuries, changes in health, especially mental health, are impeding economic growth and causing a contraction in the supply of labour. 418. This chapter describes a fragmented health system that is not configured for the new demands it faces, and one that does not view labour market participation of young people as a core health outcome. That is the central fault line. All too often, the way the NHS works inhibits rather than enables participation. That has to change. 5.1. The social foundations of poor health. 419. The health of young people does not exist in isolation from the social and economic conditions in which they grow up. Poverty and housing instability have deteriorated for a significant proportion of the population. Note 446. Our Children, Our Future. gov.uk. www.gov.uk. Published December 2025. Available at https://www.gov.uk/government/our-children-our-future-tackling-child-poverty. And the text continues, putting pressure on families and communities. Worsening social and environmental conditions pose direct health risks and drive poor health behaviours. Poor diet, low activity, smoking/vaping, alcohol problems, low uptake of vaccinations, which then lead to poor health outcomes and create the underlying vulnerability on which the health system then fails to act. Everything described in this chapter operates on top of that foundation. The NHS cannot solve what poverty produces, but it can do far more than it currently does to prevent health problems from becoming participation problems. 5.2. The scale of the change. 420. Chapter 1 sets out the evidence on health and young people who are neat. The headline figures bear repeating here because they frame everything that follows. 421. Disability rates among neat young people have more than doubled over the past 15 years. In 2024/25, nearly half of young people who are neat in the UK, 45%, reported having a disability, more than doubling from 21.1% in 2013/14. Note 447. The Employment of Disabled People 2025, gov.uk. www.gov.uk. Published November 2025. Updated 24th of March 2026. Available at https://the-employment-of-disabled-people-2025. And the text continues. Disability prevalence among all 16 to 24-year-olds has also doubled, from 10% to 19.7% over the last 10 years. Note 448. The Employment of Disabled People 2025, gov.uk. www.gov.uk. Published November 2025. Updated 24th of March 2026. Available at www.gov.uk/the-employment-of-disabled-people-2025, and the text continues. 422. Mental health problems are the principal driver. Over the past 15 years, the proportion of disabled NEET young people citing mental health as their main health problem has nearly doubled, rising from 24.3% in 2011 to 42.6% in 2025. Meanwhile, those reporting physical or other health problems have more than halved, falling from 74.1% to just 32.1%. Note 449. Trends in young people not in education, employment or training. Youth Futures Foundation. youthfuturesfoundation.org. Published May 2025. Available at https://youthfutures-foundation.org/wp-contents/neets-trends-analysis-q2-2025.pdf. And the text continues. 423. The duration of staying NEET as a consequence of illness is devastating. Of those who fell into this category between 2017 and 2019, almost 8 in 10 were still NEET more than 2 years later. Note 450. Not working. Resolution Foundation. www.resolutionfoundation.org. Published June 2022. Available at https://www.resolutionfoundation.org/app/2022/not-working.pdf. And the text continues. This is not a transient problem. It is a long-term detachment driven by ill health and by the inability of systems to accommodate health-based needs. Mental health. 424. It is mental health conditions that are now the most commonly reported health condition among NEET young people. 1 in 5, 20.0% of all NEET young people report a mental health condition, more than double the share in 2012, when it stood at 7.7%. Note 451. NEET primary health condition estimates from the APS, gov.uk. www.gov.uk. Published 16th of March 2026. Available at https://fast-track//4235-5278-08DE58D1314F. And the text continues. 425. This explosion has primarily been in mental health issues such as anxiety and depression, rather than in serious mental illness, SMI, which had an estimated prevalence of 1.16% for people aged 14 and over in England in 2023. Note 452. Office for Health Improvement and Disparities. Estimated prevalence of severe mental illness in England. Report April 2026. Available at https://www.gov.uk/government/statistics/adult-mental-health-and-wellbeing-profile-April-2026-update estimated-prevalence-of-severe-mental-illness-in-England-report. And the text continues. 426. Girls report significantly higher levels of anxiety and depression than boys. The UK ranks 27th out of 36 countries for children's mental health in the UNICEF INCENTI ranking of child well-being, well below peer nations like the Netherlands and France. Note 453. INCENTI Report Card 19, UNICEF, www.unicef.org, published 14th of May 2025. Available at https://www.unicef.org/innocenti-report-card-19-child-well-being-understrike-2025.pdf. And the text continues. Call for evidence. Mental Health UK response. Almost 48% of all lifetime mental health conditions emerge before the age of 18, a finding reinforced by global epidemiological evidence showing that nearly half, 48.4%, of all mental disorders begin before 18 and over 62% before 25. 427. NHS England survey of the mental health of children and young people found stark inequalities. Children aged 8 to 16 with a probable mental disorder were more than 4 times more likely to live in a household unable to afford enough food and almost 3 times more likely to live in a household unable to afford heating than those without a probable mental disorder. Note 454. Mental Health of Children and Young People in England 2023. Wave 4 follow-up to the 2017 survey. Data tables, NHS England, www.england.nhs.uk. Published November 2023. Available at https://wave-4-follow-up/data-sets. And the text continues. Most of today's 16 to 24-year-olds were aged between 11 and 18 during the COVID-19 pandemic. They experienced significant deterioration in their mental health and major disruption to their education. Pre-existing inequalities widened, with the most disadvantaged young people hit hardest, those already at higher risk of becoming NEET. Note 455. Understanding the impact of COVID-19 on young people across the UK. An evidence synthesis. Learning and Work Institute. www.learningandwork.org.uk/. Published March 2023. Available at https://poverty-inequality.scot/2020//uploads/2023/learning-impact-of COVID-19-on-young-people-March 2023.pdf. And the text continues. Levels of psychological distress among 18 to 24-year-olds had almost doubled in April 2023, compared with 2017/18. Figure 25. Note 456. Suleiman Meranisha et al. Unequal Pandemic, Fairer Recovery. The COVID-19 Impact Inquiry Report. The Health Foundation, www.health.org.uk, published July 2021. Available at https://doi.org/10378029/HF-2021-HL12. Figure 25. Proportion of 8 to 16-year-olds with a probable mental disorder by gender. England 2017 to 2023. Line chart tracking the prevalence of probable mental disorder among young people by gender from 2017 to 2023. Both boys/young men and girls/young women show upward trends. Girls/young women increase from 12.4% in 2017 to 19.8% in 2023, a 7.4 percentage point rise, while boys/young men rise from 12.8% to 20.8%, an 8.0 percentage point increase. By 2023, boys/young men have a slightly higher prevalence at 20.8% compared to 19.8% for girls/young women. Source: Mental Health of Children and Young People in England 2023. Wave 4 follow-up to the 2017 survey. Data tables: NHS England Digital, www.digital.nhs.uk, published 21st of November 2023. Available at Mental Health of Children and Young People in England 2023. Wave 4 follow-up to the 2017 survey. Data tables: NHS England Digital. And the text continues. 428. But the pandemic did not create these problems, although it may have accelerated them. The trends in mental health prevalence were already rising well before the pandemic. Note 458. Understanding drivers of recent trends in young people's mental health. Youth Futures Foundation, www.youthfuturesfoundation.org, published July 2025. Available at https://youthfuturesfoundation.org/wp-content/2025/07/ understanding-drivers-of-recent-trends-in-young-people's-mental-health-july-2025-final.pdf. And the text continues. 429. The interim report of the Independent Prevalence Review led by Professor Peter Fonagy confirms the scale and complexity of what is happening. Note 459. Independent Review into Mental Health Conditions, ADHD and Autism. Interim Report. gov.uk. www.gov.uk. Published 31st of March 2026. Available at https://assets.publishing.service.gov.uk/media/69cb-d2369dd81b3f213c660 independent-review-into-mental-health-conditions-ADHD-and-autism-interim-report.pdf ? And the text continues. Psychological distress has increased most sharply among younger people, marking a significant reversal of previous age-based patterns. The largest increases are in emotional symptoms, loneliness, sleep problems, loss of confidence, and difficulty concentrating. Among those reporting high levels of distress, functional impairment has also increased. 430. That matters enormously for this review. It confirms that what we are seeing is not simply a change in how young people talk about their mental health. It is a change in their capacity to participate. There is a difference between a generation that is more willing to name its struggles and a generation that is functionally less able to engage with education and work. 431. The relationship between diagnosis, disability, distress and participation is not straightforward, but they are often conflated. As thousands of disabled people prove every day, it is entirely possible to have a diagnosis and a disability and still be able to participate with the right support. Equally, individuals without a formal diagnosis may be significantly impaired. It is functional impairment rather than diagnosis per se that predicts participation outcomes. The health system needs to respond to that distinction, but has not to date done so. Neurodevelopmental conditions. 432. The Fonagy Interim report confirms that the neurodevelopmental picture is particularly striking. Referrals, waiting lists and recorded diagnoses for ADHD have increased substantially. The number of children and young people awaiting for an ADHD assessment arose from around 21,000 in April 2019 to around 270,000 by December 2025. Autism diagnoses have followed a similar trajectory, with especially rapid growth among females and young people without a learning disability. Note 460. Independent review into mental health conditions, ADHD and autism. Interim report. gov.uk. www.gov.uk. Published 31st of March 2026. Available at https://assets.publishing.service.gov.uk/media/69cb independent-review-into-mental-health-conditions-ADHD-and-autism-interim-report.pdf ? And the text continues. 433. But the underlying prevalence of ADHD symptoms has been far more stable. Population-based estimates of autism in children have also remained broadly stable. Multiple things are happening at the same time. Stable underlying prevalence can coexist with rapidly rising diagnosis, referral and service demand. The health system is under enormous pressure, but the relationship between that pressure and underlying need is not straightforward. Fonagy points to the way in which health, education and welfare systems can make diagnosis the practical route through which families seek recognition, earlier intervention or additional support. Note 461. Independent review into mental health conditions, ADHD and autism. Interim report. gov.uk. www.gov.uk. Published 31st of March 2026. Available at https://assets.publishing.service.gov.uk/media/69cb db23690dd81b3f213c660 independent-review-into-mental-health-conditions-ADHD-and-autism-interim-report.pdf ? And the text continues. 434. That complexity matters. If the rise in diagnoses were simply the correction of historic under-recognition, the response would be straightforward. More assessment capacity and more clinical treatment. If, as the evidence increasingly suggests, the current patterns are shaped as much by the design of systems as by underlying need, including the incentives those systems create and the tendency to medicalize forms of distress that may have broader social or developmental roots, then the response must be broader. It must include earlier, more accessible forms of support that do not depend on long waits for specialist diagnosis, and it must address the social determinants producing the distress in the first place: poverty, family instability, social media. Critically, as there seems to have been a widening of what is recognised as disability within the system, and with it an expansion of the range of diagnoses and conditions that legitimise non-participation, the key issue is not the label itself, but the functional impact. Until the health and wider system gets to grips with that key distinction, too many young people will be categorised as unfit to work, when, with help, support and earlier intervention, they would be able to do so. 5.3. The Evidence Debate. 435. The public discussion of these trends has become heavily polarised. Some emphasise under-recognition and demand more diagnosis. Others raise concerns about overdiagnosis and medicalisation. This review does not align with either camp. The evidence does not support the claim that nothing real has changed or that young people have somehow become softer than previous generations. Functional impairment has increased. Participation has deteriorated. The scarring is measurable. Young people are not inventing their distress. But nor does the evidence support the assumption that every rise in diagnosis reflects a corresponding rise in underlying condition. A system that makes diagnosis the only reliable gateway to support will inevitably produce more demand for diagnosis, regardless of whether underlying prevalence has changed. And a system that has a single diagnosis for such a broad range of symptoms and need is woefully simplistic, inappropriate, and risks diminishing the support and resources for those with the greatest needs. These are design problems, not clinical ones. 436. What the evidence does support is this: a growing number of young people are in genuine distress, while the system is struggling to respond. And the current model, one that depends on diagnostic thresholds as the gateway to support and organises care in clinical silos, is failing to convert either diagnosis or treatment into sustained participation. The question is not how many young people have a diagnosable condition. The question is how many are able to participate and what the system is doing about it. The answer for too many is not enough. All too often a diagnosis becomes a gateway into the health and welfare system and to a life outside the labour market. Instead of assuming that people with a diagnosis cannot participate, the first question the system should be asking is, what can they do and how can it enable that to happen? 437. Poor health reduces participation. Reduced participation worsens health. Worsening health further reduces the likelihood of return. That is the vicious cycle that the system does not break. In too many cases currently, it reinforces it. 438. This is therefore no longer a labour market problem with a health dimension. It is a health crisis with labour market consequences. The system that responds to it was built for a different era and a different cohort. The sections that follow examine how and why it is failing. 5.4. The spectrum the system doesn't see. 439. The system treats mental health as if it were binary. A young person either meets the threshold or they do not. They're either referred or they wait. Of course, a young person may get SEND support at school or help from their family at home. But in other aspects, without a clear diagnosis, young people too often go without support. But most common mental health conditions do not easily fit binary distinctions. Anxiety, depression, ADHD, eating disorders, these exist on a spectrum. They range in severity, they fluctuate, and their impact on a young person's ability to participate depends not only on the clinical picture, but on the social circumstances around it. A young person with moderate anxiety and a stable home, a supportive school, and an engaged parent is in a fundamentally different position from a young person with the same clinical presentation who is living in temporary accommodation, out of school, and without an adult advocate. The system does not make that distinction. It applies the same threshold, the same waiting list, and the same pathway regardless. 440. We do not currently have a framework that brings clinical severity and social circumstances together in the way that, for example, maternity services have long combined clinical and social risk to shape care pathways. We do not know with any confidence how many young people sit at different points on the spectrum of severity, or how that picture changes when social disadvantage is overlaid. There are no agreed criteria that would allow less complex presentations to be identified through screening rather than full clinical assessment, and it is the reliance on full assessment that drives much of the waiting time described in this chapter. There is no shared understanding of what appropriate care looks like at different levels of need, or which of those levels could be served by different models entirely, whether that is digital provision, social prescribing, peer support, or trained non-clinical staff rather than clinicians. And there are no metrics that tell us whether the response at any given level is actually working, beyond whether an appointment happened. 441. All of this matters because the system cannot cope with the volume it faces if every young person who presents with distress is routed towards the same clinical pathway. Even more critically, response to distress does not sit solely within health services, especially when identified early. Effective support often comes from education, family and community settings. When early intervention does not happen elsewhere in the system, the NHS ends up having to step in. Unless the response becomes more of a cross-system responsibility rather than one that sits primarily with the NHS, the latter will find itself overwhelmed. 442. The point is that the shape of the need is not uniform and the response should not be either. Until we understand that shape, its distribution across severity and social risk, and what a proportionate response looks like at each level, we will go on applying a blunt instrument to a problem that demands something more precise. 443. Similarly, mental and physical health issues frequently co-occur, and many children and young people have complex needs that demand a joined-up response. But the system tends to treat each condition separately, through different services and different pathways, when what the young person experiences is a single interacting burden. Until services are organised around the person rather than diagnosis, co-occurring conditions will continue to drive longer and deeper spells of disengagement. 5.5. Unequal access. 444. Health problems do not fall equally across society. They are patterned by disadvantage. Young people from the most deprived backgrounds are more likely to experience mental ill health and less likely to receive timely, effective support. The system fails hardest where the need is greatest. 445. Children from the least deprived areas in England are 1.6 times more likely to have their referrals to CAMS accepted than children from the most deprived areas. Note 462. Syal Kapil et al. Investigating inequalities in children and young people's mental health care and outcomes. Prospective longitudinal analysis from the STADIA trial. The British Journal of Psychiatry. Published 27th of April 2026. Available at https://www.cambridge.org/article/E4DF4729DE56 DAA81034337B DD169BD8. And the text continues. Almost 4 in 10 17 to 19-year-olds in the most deprived areas who sought specialist support were still waiting or never received it, compared with 3 in 10 in the least deprived. Note 463. COVID Social Mobility and Opportunities Study, COSMO, www.cosmostudy.uk, published November 2023, available at https://cosmostudy.uk/publication_PDFS/mental-and-physical-health-final.pdf. And the text continues. Black and mixed ethnicity young people are more likely to enter mental health services via crisis or compulsory routes, and less likely to access early voluntary support. Note 464. Ed Brook-Charles, Julian and Patali Pradisa. Ethnic Differences in Referral Routes to Young Mental Health Services. Journal of the American Academy of Child and Adolescent Psychiatry. Volume 58, Issue 3. PubMed. www.pubmed.ncbi.nlm.nih.gov. Published March 2019. Available at https://pubmed.ncbi.nlm.nih.gov/30768415/. And the text continues. Cultural barriers, mistrust of institutions and a lack of culturally competent provision means that some communities are systematically underserved. Note 465. Racial disparities in mental health. Literature and Evidence Review. Race Equality Foundation. www.raceequalityfoundation.org.uk. Published November 2022. Available at https://wp-content//mental-health-report-v5-2.pdf. And the text continues. Young people from ethnic minority backgrounds are more likely to reach services late, when their needs are more acute and the path back to participation is longer. Any serious strategy for reducing health-driven need must address these inequalities head-on. 5.6. Slow access. 446. There is evidence that timely healthcare supports better labour market outcomes. Note 466. For example, the impact of bariatric surgery on monthly employee pay and employee status. England, April 2014 to December 2022. Office for National Statistics. Published October 2024. Available at https://www.ons.gov.uk/people, population and community /health and social care /health and well-being /articles the impact of bariatric surgery on monthly employee pay and employee status. England /April 2014 to December 2022. And the text continues. The system is not delivering timely health care. Most tellingly of all, waiting time targets which exist for physical health conditions are entirely absent for mental health services. 447. The front door of the NHS is itself part of the problem. General practice, where most young people first present with health difficulties, is weakest where need is greatest. GP surgeries serving deprived parts of England receive on average 9.8% less funding per needs-adjusted patient. Practices in poorer areas employ fewer GPs and perform less well on all major markers of quality. CQC inspectors and patient satisfaction included. Note 467. Fairer funding for general practice in England. Nuffield Trust. www.nuffieldtrust.org.uk. Published 12th of December 2024. Available at https://www.nuffieldtrust.org.uk/fairer-funding-for-general-practice-in-England. And the text continues. Young people report lower satisfaction with GP services than older age groups. Note 468. NHS GP Patient Survey 2025 National Report. NHS England. www.gp-patient.co.uk. Published 10th of July 2025. Available at https://gp-patient.co.uk/latest-survey/results. And the text continues. For many young people, the GP is where health, education and work intersect, but the system does not equip primary care to perform that role effectively. There are no clear, well-understood routes between GPs, mental health support teams, school counsellors and specialist care. For a young person in distress, the first contact with the health system is often the point at which the system fails them. 448. Waiting times for specialist services vary enormously. Median waits for CAMS range from over 100 days in some integrated care boards to 6 days in others. The share of referrals receiving 2 contacts, used as a proxy for entering treatment, varies from 16% to 63%. Note 469. Children's Mental Health Services 2023-2024. Children's Commissioner, www.childrenscommissioner.org.uk. Published May 2025. Available at https://assets.childrenscommissioner.gov.uk/WP uploads//2025//020/children's-mental-health-annual-briefing-may-2025.pdf. And the text continues. 449. The median waiting time for an autism assessment for 0 to 17-year-olds is almost 600 days, a 5-fold increase since 2019. Note 470. Autism Statistics, NHS England Digital, digital.nhs.uk. Published 12th of February 2026. Available at https://digital.nhs.uk/data-and-information/statistical/autism-statistics. And the text continues. Community paediatrics waiting lists have tripled in recent years, with community paediatrics and speech and language therapy making up almost 75% of children's community waiting lists. Almost 25% of children wait a year or longer for community health services. Note 471. Community health services waiting lists, NHS England, www.england.nhs.uk. Published 2026. Available at https://www.england.nhs.uk/statistics/statistical-work-areas/community-health-services-waiting-lists/ And the text continues. 450. In 2023/24, 910,567 were referred to CAMS in England, almost 1 in 5. 171,134 had their referral closed before they accessed any support. Thresholds have risen. It often seems the only way to become eligible for more help is to become more unwell. Note 472. Waiting times for children and young people's mental health services 2023-24. NHS England. www.digital.nhs.uk. Published 25th of February 2025. Available at https://digital.nhs.uk//waiting-times-4-children-and-young-peoples-mental-health-services-2023-24-response. And the text continues. 451. There are long waits for CAMS and very little in between primary care advice and CAMS treatment. Parents are sent self-help information, but there is no formal bridging care, and families are left to wait. This is a crucial missed opportunity. 452. Without early intervention, the risk of future school absence or other NEET risk factors is likely to grow. Reviews consistently find a major gap in support for children who do not meet CAMS thresholds and have no alternative provision, particularly in areas where early intervention, school-based and voluntary sector services have been cut back. The result is predictable. Problems escalate until crisis care is needed, with little communication or interim support for those on waiting lists. Note 473. Are we listening? A review of children and young people's mental health services. Care Quality Commission. www.cqc.org.uk. Published March 2018. Available at https://www.cqc.org.uk/sites/default/files/20180308B _are we listening report.pdf. And the text continues. 453. The most cost-effective point of intervention is before crisis, not after it. Yet the system consistently invests in acute response rather than prevention. School-based counselling, community youth mental health hubs, and peer support programs have all shown promise in reducing escalation, but none operates at the scale required. 454. A prevention-first approach would mean funding early intervention services as core provision, not as discretionary add-ons vulnerable to annual budget cycles. It would also mean recognising that prevention is not solely a health system responsibility. Schools, employers, youth services and local government all have a role. Until prevention is funded and governed as seriously as treatment, the system will continue to be overwhelmed by demand it could have reduced. 5.7. A thin evidence base. 455. In our discussions with mental health charities and professionals, it was acknowledged openly that the evidence for effective interventions to help young people with health conditions is notably lacking. There have been fewer than 10 high-quality randomised or quasi-experimental studies on UK youth employment interventions in the past 2 decades, compared with hundreds in education. This is an under-researched area. We lack robust evidence on causes and on what actually works to support individuals into sustained work and education. 456. One promising model does stand out. Individual placement and support is one of the few approaches with a strong international evidence base demonstrating that integrated employment and health support can produce sustained labour market outcomes for certain cohorts. IPS places employment specialists directly within clinical teams, so that job search, employer engagement and clinical care happen in parallel rather than in sequence. Job search is tailored to individual preferences and personalised one-to-one support is provided and continues for as long as is necessary after the person gains employment. This has been shown to be effective for people with severe mental illness. Note 474. Supported employment for adults with severe mental illness. Cochrane. www.cochrane.org, published 13th of September 2023. Available at https://www.cochrane.org/evidence/CD008297 supported employment adults severe mental illness. And the text continues. And people with alcohol and drug dependency. Note 475. Marsden, John et al. Superiority and cost-effectiveness of individual placement and support versus standard employment support for people with alcohol and drug dependence. A pragmatic, parallel group, open-label, multi-center, randomized, controlled, Phase 3 trial, e-clinical medicine. Published February 2024. Available at https://doi.org/1010.2023.102400. And the text continues. While IPS has been attempted for people with common mental health problems, the evidence and effectiveness isn't as clear-cut in this cohort. Note 476. Health-led trials, evaluation synthesis report, gov.uk, www.gov.uk, published August 2023. Available at https://www.gov.uk/health-led-employment-trials-evaluation/health-led-trials-evaluation/synthesis-report. And the text continues. 457. In England, IPS is being rolled out for those with severe mental health conditions such as schizophrenia and bipolar disorder and within drug and alcohol services. The recently launched Connect to Work programme in England and Wales complements existing IPS provision, providing IPS and supported employment programmes to adults who are economically inactive due to disability, health conditions or other complex barriers. Crucially, Connect to Work will see IPS reach people with a wide range of disabilities and health needs. 458. There is better evidence on the clinical effectiveness of specific treatments such as CBT, but even then it is not unequivocal when it comes to young people. NHS talking therapies have good access and have been shown to produce positive labour market outcomes for those over 25, but recovery rates are lower for the 16 to 24-year-old cohort. Notes 477 and 478. Note 477. The impact of NHS talking therapies on monthly employee pay and employment status. England, April 2014 to December 2022. ONS. www.ons.gov.uk. Published December 2024. Available at https://www.ons.gov.uk/people, population and community /health and social care /mental health /bulletins /the impact of NHS talking therapies on monthly employee pay and employment status. England /April 2014 to December 2022. Note 478. NHS Talking Therapies Annual Interactive Dashboard. NHS England. www.digital.nhs.uk. Published 25th of September 2025. Available at https://app.powerbi.com/view REEYJRLJOINZC4ZJUZZWETY TRHNC00N2 JMLWI1NWYTODK 3YTG5MWM5ZT BMLIWIDCL6LJ M3YZM1NGLYLT G1YJATNDDMNS1I MJLYLTA 3YJQ4ZTC 3NGV LMYJ9. And the text continues. For the older age range, the labour market outcomes are so positive that they are scored favourably by the Office for Budget Responsibility. Note 479. Economic and Fiscal Outlook, November 2023. OBR, www.obr.uk. Published November 2023. Available at https://obr.uk//economic-and-fiscal-outlook-web-accessible.pdf. And the text continues. Sadly, it is likely that talking therapies are less effective at engaging and retaining younger people. Note 480. Saunders, Rob, Sue, J. Wan, Buckman, Joshua et al. Effectiveness of psychological interventions for young adults versus working-age adults. A retrospective cohort study in a national psychology treatment program in England. The Lancet Psychiatry Volume 12, Issue 9. The Lancet, www.thelancet.com. Published September 2025. Available at https://doi.org/1016/s2215-0366 open bracket 25 close bracket 00207-X. And the text continues. 459. The current system is not set up to deal with the prevalence of distress, Fanagi reports. High levels of anxiety and depression among young people do not lend themselves to traditional hospital-based mental health treatment, or to many existing community-based models of care. Nor is it feasible to expect the NHS to cope alone with that volume of demand. Effective responses to distress often sit outside traditional health care, in education, communities and employment settings. Similarly, alternative provision through digital channels has shown some evidence of success, but has not yet been implemented at scale, and there is huge variability in the quality of what is available. 460. The most recent NICE guidance on digital interventions for CYP experiencing low-moderate symptoms of anxiety or low mood identified 4 different tools that can be used as an initial treatment option. However, NICE are clear that the evidence base is very limited. Studies are small, often lack comparators, and provide only weak evidence of improvements in anxiety symptoms. Other key gaps include effectiveness for neurodivergent young people and rates and reasons for stopping treatment. An evidence base is largely lacking. This feels like a major weakness in the health ecosystem. 5.8. Funding, Gaps and Variations. 461. It is an oft-repeated assertion that mental health is the Cinderella of the NHS. We have heard it strongly argued during the review that services are overstretched and underfunded. We heard evidence that mental health receives less than 10% of NHS spending, despite accounting for 20% of the morbidity burden. Figure 26, Note 481. Independent Investigation of the National Health Service in England, September 2024. gov.uk. www.gov.uk, published September 2024. Available at https://lord-darcy-independent-investigation-of-the-national-health-service-in-england-updated-20-September.pdf. And the text continues. Children and young persons' mental health services receive around 11% of all mental health spending, despite those aged 18 and younger accounting for 33% of all contacts with mental health services. Note 482. Share of all NHS spending on mental health services for children and young people, compared with the share of people in contact with mental health services who are aged 0 to 18. Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/government/people-young-people-and-work-interim-report. And the text continues. 462. For 2026/27, mental health spending is forecast to reach £16.1 billion, a real terms increase of around £140 million compared with 2025/26. Note 483. Statement on NHS Mental Health Spending 2026/27. House of Commons. Written Statements. HCWS 1397. UK Parliament House of Commons 2026. Available at https://c1c9fc03b8ca/c1c9fc03b8ca/written statements. And the text continues. The number of NHS staff involved in providing mental health services to children and young people has more than doubled between 2016 and 2025, growing from 7,965 FTE to 18,156 FTE. This growth hasn't been equal in all staff groups, with the overall share of staff in some professional groups falling. Share of staff is down 7.5 percentage points for mental health nursing and down 5 percentage points for child and adolescent psychiatry. Note 484. Analysis of mental health workforce supporting children and young people, CYP. Young People and Work Interim Report, Analytical Annex. Available at https://www.gov.uk/government/people-young-people-and-work-interim-report. And the text continues. 463. On the other hand, the workforce has seen a welcome increase in the share of roles supporting mental health support teams, rising from 4% in 2016 to almost 18% in 2025. Note 485. Analysis of mental health workforce supporting children and young people, CYP. Young People and Work Interim Report, Analytical Annex. Available at https://www.gov.uk/government/people-young-people-and-work-interim-report. And the text continues. Mental health support teams are now operational and accessible to over 50% of pupils and learners in schools and colleges, with full coverage planned by 2029/30, and that is welcome. Note 486. Transforming Children and Young People's Mental Health Implementation Programme. gov.uk. www.gov.uk. Published May 2025. Available at https://transforming_health_program_2025.pdf. And the text continues. There is growing evidence that school-based mental health intervention helps reduce anxiety and depression. But mental health support teams often do not share information with GPs. The gap between school-based early support and specialist CAMS treatment remains wide. 464. Alongside pleas for more investment in mental health services, we also received compelling evidence that the way existing resources are currently utilised is suboptimal. Variability in spending and performance is enormous. 465. Investment per child referred ranges from £548 to over £2,500 between integrated care boards. Note 487. Children's Mental Health Services 2023/2024. Children's Commissioner. www.childrenscommissioner.gov.uk. Published May 2025. Available at https://childrenscommissioner.gov.uk/children's-health-annual-briefing-may-2025.pdf. And the text continues. Unmet need ranges from 5% to 40% of children with mental health needs accessing specialist care. Note 488. Inequalities in access to children and young people's mental health services in the Midlands. The Strategy Unit. www.strategyunitwm.nhs.uk. Published July 2021. Available at https://www.strategyunit.wm.nhs.uk/sites/2021-200727 Percentage 20 inequities percentage 20 in percentage 20 access percentage 20 2 percentage 20 CYP percentage 20 MH percentage 20 services percentage 20 in percentage 20 the percentage 20 Midlands percentage 20 dash percentage 20 strategy percentage 20 unit percentage 20 report percentage 20 dash percentage 20 final.pdf. And the text continues. The NHS pays very disparate amounts for care, and there are deep inefficiencies in its delivery, all of which adds real weight to the argument that commissioning of these services can be significantly improved. Critically, funding is not currently tied to outcomes. Figure 26. Share of NHS budget by setting hospital community mental health primary care, 2006 to 2022. Stacked area chart, financial years 2015/16 to 2023/24. showing budget share percentage of 7 service categories stacking to 100%. Acute services, dark blue, dominates 38 to 63% range, shows growth. Specialised services, light blue, 14 to 25% range. Core mental health, gold, approximately 7 to 14% range, shows growth. Community services, light sage, 7 to 12% range. Primary medical care, green, 8 to 12% range. Continuing care, dark green, 4 to 6% range. Other services, light grey, 12 to 19% range, shows decline. Y-axis percentage, 0 to 100%. X-axis, financial years. Source, Department for Health and Social Care. Total CCG/ICB and direct commissioning net expenditure, November 2023. And the text continues. 5.9. Activity, not outcomes. 466. The review's engagement with local health leaders elicited a deep concern that the health system places too much emphasis on clinical activity and access targets and too little accountability for education or employment outcomes. The health system is configured for episodic treatment, not sustained functional recovery. Funding models reward activity and throughput, not whether a young person returns to school, sustains further education or progresses towards work. Commissioners do not have incentives to target outcomes like entering work or education and are not always enabled to do so with flexibility and autonomy. Participation is not an outcome the NHS is held accountable for, nor does the system focus sufficiently on improving function, rehabilitation or occupational therapy provision. Too often it stops at diagnosis and treatment without asking whether the young person can participate in education or work as a result. 467. Worse than the gaps in treatment, the interaction between the health system and the benefit system can inadvertently restrict rather than promote participation. The health system certifies incapacity. The benefit system administers it. Neither is incentivized to support the young person back towards participation. The result is that health-related inactivity, once ended, becomes self-reinforcing. 468. The poster child for this structural failure is the fit note. Once young people are struggling, the fit note system does not encourage participation. The default not fit for work note is quick for pressured GPs and often expected by patients, but it rarely generates a plan for staying in or returning to study or work. GPs have cited a lack of training on completing the fit note, a lack of knowledge resulting in default judgments of not fit, and no financial incentive to keep people in work. With approximately 11 million notes a year in England, and the vast majority, 94%, marked not fit, many people drift from short absence into long inactivity without adjustments or review. This has been getting worse since the pandemic. Note 489. Fit Notes issued by GP Practices, England, December 2025. Official statistics, NHS England, www.digital.nhs.uk. Published April 2026. Available at https://digital.nhs.uk/fit-notes-issued-by-GP-practices/December-2025. And the text continues. 469. National fit note data by age are not routinely available, but for universal credit, over 100,000 young people declared a fit note and joined the health journey in 2025, going on to provide 300,000 fit note declarations in total that year. That is a staggering number of young people being set by the NHS on a path towards long-term inactivity. Note 490. Young People and Work Interim Report, Analytical Annex. And the text continues. When surveyed, very few healthcare professionals thought that more fit notes should be issued. 9% agree, 48% disagree. Or that the fit note system provides young people with the support they need. 9% agree, 49% disagree. Note 491. Survey of healthcare professionals. See accompanying analytical annex. Available at https://www.gov.uk/government/people-and-work-interim-report. Full research report to follow publication. And the text continues. 470. The underlying problem is that the system operates in binary terms, fit or unfit, in or out, present or absent. The maybe fit option appears to be underused, which may suggest that many GPs are not confident in using it proactively. Yet what many young people describe is not permanent incapacity but variability. Many are capable of studying or working on some days but struggle on others. They do not describe choosing inactivity over work. They describe managing fragile participation in systems that are not designed for fluctuation. The fit note is the instrument through which that binary logic is applied. A not fit note for an 18-year-old who has never worked does not pause a career. It prevents one from starting. This needs fundamental reform. 5.10. Silos, not integration. 471. A consistent theme from our call for evidence and our engagement with young people is the siloed nature of how the NHS operates. There are multiple efforts at local level to bring the NHS alongside other public agencies, but integration has been hard to achieve in practice. Local health leaders expressed concerns about short-term fragmented funding that undermines early intervention and the consistent use of expertise in the voluntary and community sector. 472. Even within the NHS, siloed working is commonplace. Poor communication between GPs, schools, CAMs and other referrers contributes to inappropriate referrals, poor signposting and delay. Note 492. Enhancing referrals to child and adolescent mental health services, the EN-CAMS Mixed Method Study, NIHR, www.journalslibrary.nihr.ac.uk, published June 2025. Available at hsdr/hsdr/gydw4507. And the text continues. Where mental health services and schools fail to share information, there is often no joined-up approach to care, no culture of sharing care plans or child protection plans, putting children at risk. Note 493. Are we listening? Review of children and young people's mental health services. Qualitative analysis. Care Quality Commission. www.cqc.org.uk. Published March 2018. Available at https://www.cqc.org.uk/sites/default//20180308 Are we listening qualitative.pdf. And the text continues. This is not limited to CAMS. Mental health support teams in education settings often do not share information with GPs. 473. The transition from paediatric to adult healthcare often coincides with critical points of transition across the education pathway or into employment. A consistent theme from the call for evidence was the challenge of transition points and cliff edges. The move from paediatric to adult care is one such point of jeopardy for vulnerable young people at risk of becoming NEET. Gaps between CAMS and adult mental health services mean people are left without care at critical periods. Note 494. Healthcare Transition Report 2024-2025. Bernardo's. www.bernardos.org.uk. Published 4th of April 2025. Available at https://www.bernardos.org.uk/research/young-researchers-healthcare-transition-report-2024-25. And the text continues. Transitions are handled rigidly and administratively rather than based on patient need. Young people are frequently moved to adult services at age 18, despite guidance that transitions should reflect individual maturity and circumstances. Note 495. State of Care 2024/25. CQC. www.cqc.org.uk. Published 24th of October 2025. Available at https://www.cqc.org.uk/major-report/state-care. And the text continues. Poor planning means some fall through the gaps, including cases where CAMs discharge young people without effective onward referral. Some go on to experience severe or even life-threatening deteriorations in their condition. Note 496. Investigation Report. Transition from child and adolescent mental health services to adult mental health services. Health Services Safety Investigations Body. www.hssib.org.uk. Published 15th of November 2021. Available at https://www.hssib.org.uk/transition-from-child-adolescent-mental-health-services-2-adult-mental-health-services/investigation-report/ And the text continues. 474. These silos extend well beyond the NHS. Integration across health, education, employment and wider local systems remains partial and inconsistent. Lines of accountability for achieving better participation outcomes are unclear and weak. Data is not shared across silos. Geographic boundaries between health, education and local government do not align. No single institution holds a complete picture of a young person's journey. Considering mental health, healthcare professionals that we surveyed were asked to select the top 3 ways the health system could play a more effective role in reducing the number of young people who are NEET. Reducing waiting times was the most popular answer, followed by better signposting to non-clinical support and a more tailored holistic approach to care. Over half of the survey respondents thought that there was inadequate availability of non-NHS services in their area to signpost patients to for non-clinical support to improve patients' mental or physical health or well-being. Note 497. Survey of healthcare professionals. See accompanying analytical annex. Available at https://www.gov.uk/government/people-and-work-interim-report. Full research report to follow publication. And the text continues. 475. The NHS also has limited engagement with employers. If participation in work is to become a health outcome, the health system needs to understand the labour market it is trying to return young people to. There is little evidence of systematic NHS engagement with employers on workplace adjustments, phased returns or supported employment for young people with health conditions. The Keep Britain Working review led by Sir Charlie Mayfield confirms this. Note 498. Keep Britain Working. Final report. gov.uk. www.gov.uk. Published 5th of November 2025. Available at https://www.gov.uk/keep-britain-working-review-final-report. And the text continues. Employers are largely absent from the health and work conversation. The NHS treats patients. Employers manage absence. Nobody manages the return. GPs issue fit notes without contact with the employer. The employer receives a certificate but often no guidance on adjustments. There is no systematic link between the two. Occupational health coverage is deeply unequal. Only around 45% of employees have access to occupational health services, with coverage lowest among small employers and in lower paid sectors, precisely the entry-level jobs young people are most likely to occupy. Note 499. Keep Britain Working. Final report. gov.uk. www.gov.uk. Published 5th of November 2025. Available at https://government/keep-britain-working-review-final-report. And the text continues. 476. Mayfield argues, and I agree, that the workplace should be treated as a setting for health improvement, not merely a destination after recovery. Work can be therapeutic, but only if the health system and employers are connected. For young people with health conditions trying to enter work for the first time, that connection barely exists. They are expected to navigate alone the gap between a health system that does not consider their employment and an employer who does not understand their condition. That is a design failure. Both the health system and employers need to own it. 5.11. What is being done? 477. The 10-year health plan for England for the NHS seeks to overcome this lack of integration by creating a new generation of integrated health organisations to hold the whole health budget for a defined local population by streamlining how local government and the NHS work together, and by making ICBs coterminous with strategic authorities. Note 500. Fit for the Future. 10-year health plan for England. gov.uk. https://www.gov.uk/ Published 3rd of July 2025. Available at https://government/government/health-plan-4-england-fit-4-the-future. And the text continues. That should incentivize local health systems to integrate more effectively with other local services and to intervene earlier to help prevent young people at risk of becoming NEET. 478. The 10-year health plan sets expectations for ICBs to establish measurable outcome targets on economic inactivity and unemployment, based on the Health and Growth Accelerator model. 3 pioneer ICBs, West Yorkshire, South Yorkshire and North East and North Cumbria, began from April 2025 working with local partners to test an approach where they are held accountable for impact on people's work status through a biopsychosocial approach to early intervention and prevention, with 2 of the 3 focusing on NEET cohorts. Note 501. Funding boost to support patients to stay in and return to work. gov.uk. www.gov.uk. Published 25th of February 2026. Available at https://www.gov.uk//funding-boost-to-support-patients-2-stay-in-and-to-work. And the text continues. The health and growth accelerators also seek to strengthen a system approach to work and health, and to embed good work as a health outcome in health and care services. Work Well, a service providing holistic assessment of work and health needs for those over 16. Note 502. Expansion of support scheme to help thousands of people back to work. Gov.uk. www.gov.uk. Published 20th of January 2026. Available at https://www.gov.uk/expansion-of-support-scheme-2-help-thousands-of-people-back-into-work. And the text continues. And Youth Guarantee Trailblazers testing innovative approaches to identifying and supporting 18 to 21-year-olds at risk represent further positive steps. Note 503. Thousands more young people to get training and work support as government extends £45 million scheme. Gov.uk. www.gov.uk. Published 21st of August 2025. Available at https://www.gov.uk/government-news/thousands-more-young-people-2-get-training-and-work-support-as-government-extends-45M-scheme. And the text continues. 479. In addition, the new mental health strategy for England being developed through the government's 10-year health plan will set a new direction for the mental health system. It will focus on responding earlier and more proportionately, intervening before distress escalates to diagnosis or crisis, so that people can stay active and participate in education, work, family life and their communities. 480. It is welcome that the 10-year health plan also aims to reduce the share of expenditure on hospital care, with proportionally greater investment in out-of-hospital care and moving to longer-term budget settings and outcomes-based funding for local health systems. These changes aim to incentivize a move towards more value-based care. These are all welcome strategic changes. The question is not whether the direction of travel is right, but, as with education system reforms, whether the pace and scale of change will match the pace and scale of the crisis. 481. There is no consensus yet on the extent to which labour market participation should be an explicit outcome for the NHS. That debate needs to be resolved. Until the health system accepts that helping young people into education and work is part of its core mission, not an optional extra, it will continue to treat the symptoms of a crisis it is helping to perpetuate. 5.12. Conclusion. 482. The health chapter of this review tells a story that should disturb anyone who cares about the future of young people in this country. 483. A generation is in genuine distress. The distress is not imagined, but often severely functionally impairing. It is measurable in participation rates, in attendance data, in benefit claims, in the testimony of young people themselves. For a growing share of the NEET population, health is the primary barrier to their future. But the system, health included, is not coping with the new scale of the challenge it faces. 484. It is failing them because the NHS was not designed for this. Historically, it has never been asked, funded or measured to deliver participation. The NHS was built for episodic illness and acute treatment, not for a generation presenting with anxiety, depression, neurodevelopmental conditions and overlapping needs that require sustained, coordinated support across health, education and employment. What young people now present with has changed fundamentally, in volume, in complexity, and above all in the dominance of mental health. The system has not changed with it. Services configured for a world in which mental health was a secondary concern are now overwhelmed by a reality in which it is the primary driver of disengagement. 485. Nor has the system ever regarded helping young people into education or work as part of what it does. A young person can be diagnosed, treated and discharged and still be no closer to re-engaging with education or employment. The health system treats symptoms. It does that with dedication and often with clinical excellence. But treating symptoms while the pathway to participation collapses around the patient is not good enough. The question the system should be asking has to move from how many young people have a condition to what enables young people to remain engaged in education, work and ordinary life. The task is not to turn the NHS into an employment service, but to ensure that treatment, support and recovery are judged by whether they help young people participate in the lives they are trying to build. 486. Being in good work is good for well-being. Having more people in work grows the economy and creates more tax receipts to fund public services, including the NHS itself. There is a virtuous circle waiting to be unlocked, but it will not unlock itself. It requires the health system to do something it has never been asked to do. Take responsibility not just for whether a young person is treated, but for whether they are able to participate in the life that treatment is supposed to make possible. The way the health system works today is failing to achieve that. 487. For a generation of young people whose health is the primary barrier to their future, that is not a technical failure, but one of design, and one this country can no longer afford. That concludes Track 6. Track 7. This track is approximately 112 minutes long. Chapter 6. A welfare state not designed for participation. 488. Too many young people are being denied the chance to earn or learn. As previous chapters demonstrate, the causes of this are in large part upstream of the welfare system, in education, health and the labour market. But the welfare system matters because it is the state institution most likely to encounter young people once other systems have failed. How it works can either compound those failures or help to arrest them. 489. The welfare system has several critical functions when it comes to young people. It must provide income support for those who have yet to find work or who've fallen out of it. It must provide genuine financial security and support for independent living for young people with severe or enduring disabilities who will not be able to work. For young people in particular, the welfare system has one other core purpose, not just to be a critical safety net, but to act as a springboard to participation. But the welfare system is not currently supporting young people to earn or learn. 490. There are nearly 1 million young people in the UK not in education, employment or training. Analysis for this review has revealed that of the young people who are NEET in England, only around 1 in 5 are getting meaningful employment support from the benefit system. Around half are hidden from the benefit system altogether. They are not claiming benefits, so receive no employment support via DWP. Note 504. Hidden NEETs in England. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. 491. Of those who do claim benefits, only around a third, typically those who face the least barriers to work, get meaningful support to find a job. Note 505. Hidden NEETs in England. Young People and Work Interim Report. Analytical Annex. available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. It follows that participation outcomes are correspondingly weak. Among those first claiming a health or disability benefit aged 16 to 24, nearly half remain out of work or education 15 years later. Note 506. Internal Analysis of the Labour Force Survey. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. 492. These failures in the welfare system help to explain why, in the UK, growing levels of anxiety among young people are translating into higher levels of economic inactivity than in comparable countries. For example, young people in the Netherlands have similar high levels of anxiety conditions as those in the UK, but the NEET rate there is less than a third of ours. Note 507. Lost in Transition. An examination of why the UK NEET rate is high and rising. Resolution Foundation. www.resolutionfoundation.org. Published 28th of April 2026. Available at https://www.resolutionfoundation.org/app/2026/lost-in-transition.pdf. And the text continues. While welfare is not the main cause of poor youth participation, that lies upstream from the benefits and employment support systems, it often amplifies it. This is not sustainable, either for the young people themselves or for the taxpayer footing the price for this system failure, especially as labour market participation outcomes are deteriorating over time. 493. In this chapter we show how the way the welfare system is organised produces a poor combination of outcomes. Health and disability benefits are using an even bigger share of public spending, and yet somehow the system still fails to invest enough in support to enable young people to participate. In good part, that is also because it includes too many badly designed incentives that can deter participation and instead encourage benefit passivity. 494. This is at odds with what young people themselves say they want. Of young people who are claiming disability or health benefits, survey evidence shows that 19% are already in work. 49% believe they could work either now if the right job or support was available, or in the future if their health improves. And only 32% feel they will never be able to work or work again. Note 508. Work aspirations and support needs of health and disability customers. A focus on young people, DWP. Available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. Evidence from our surveys of young people who are NEET found that 64% of those surveyed wanted to work or do an apprenticeship, and a further 19% wanted to enter education or training. Note 509. Survey of young people, NEET. See accompanying analytical annex. Available at https://www.gov.uk/government/people-and-work-interim-report. Full research report to follow publication. And the text continues. That is not what the welfare system is enabling. A young person first claiming health and disability benefits in 2019 is 34% more likely to be NEET after 5 years than those first claiming in 2010. 495. The UK does not have a welfare system that treats participation as a core objective for young people. Instead, it too often responds to disengagement late rather than preventing it early, and ends up too often compensating for exclusion more effectively than it helps young people move back towards participation. It is designed in such a way that many young people can feel they are risking a secure income of £2,000 or more in benefits each month if they do try work. Note 510. Health study of UC Health and PIP claimant with average rent. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. 496. In the rest of this chapter we show how that failure plays out in 6 principal ways. 6.1. Investment in benefits is prioritised over employment support. 497. In the annex to this chapter we outline the principal benefits and means of employment support available to young people. Resources across the welfare system are not allocated in line with the scale of participation challenges. The spending profile reveals a system designed to provide income through benefits, not to support transitions into work. 498. Overall, the UK government spends around £8.1 billion a year on benefits directly for young people through the welfare system. Note 511. Estimated spend on 16 to 24-year-olds across PIP, TLA, ESA, JSA and Universal Credit. 2024/25. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. Of this, £4.6 billion is spent on means-tested income support through Universal Credit, £0.8 billion of which is on Universal Credit health expenditure, which is a top-up for those assessed as having limited capacity for work or work-related activity. Around £3.2 billion was spent on disability benefits through personal independence payment, which is available to people both in and out of work and aims to increase independence by providing financial support towards the extra costs that disabled people can face. In Scotland, this has been replaced by the adult disability payment. 499. We might look at this and conclude that the system is working to provide income and independence for young people who need it. Through the call for evidence and our engagement with disabled people's organisations, charities and young people themselves, it is clear that some disabled young people will never be able to work and face exceptionally high barriers to other forms of participation. The benefit system must always protect these groups. It is also overwhelmingly clear from our engagement that disabled young people want to participate, and that many could, with the right support, access a job, a course or training. The benefit system must meet the needs of both those who may never work and those who desperately want to do so. 500. But for the group of young people who are able and want to participate in the labour market, the system is not working. In 2024/25, DWP spent less than £0.2 billion funding employment support programmes for young people, plus a share of the £1.4 billion spent on job centre activity for all ages. G. £1.4 billion was spent in job centres to deliver employment support in 2024/25. Nominal direct cost, excluding spending on estates and corporate costs. Job Centre funding disaggregated by age is not available. Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. Overall, we estimate that in 2024/25, for every £1 that DWP spent on employment support for young people, around £25 was spent on benefits for young people. Note 512. Employment support and welfare spend. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. 501. The UK's approach for decades has been to pay the bill for a high structural level of youth inactivity, rather than invest in preventing it in the first place. 502. It is welcome that the government has recognised the need for increased support for young people and increased opportunities for them. Its £2.5 billion additional investment in a new youth guarantee and the growth and skills levy over the next 3 years introduces significant support primarily for unemployed young people and will unlock up to 500,000 opportunities to earn and learn over the next 3 years. It has also taken steps to address gaps in provision for disabled people and those with health conditions of working age through an investment of £3.5 billion into pathways to work over this Parliament to guarantee an offer of personalised work, health and skills support. 503. These measures are necessary. However, this funding is spread over the Parliament. The youth offer is focused overwhelmingly on unemployed rather than inactive young people, and pathways to work is not currently tailored specifically to young people. Benefit spend on young people for PIP alone is expected to rise to £6.5 billion by 2031/32. If spend on DWP employment support remains at the levels currently being funded through the Youth Guarantee, we estimate that by 2030/31, for every £1 that DWP spend on employment support for young people, around £10 will be spent on welfare support for young people. Note 513. Employment support and welfare spend. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. This is not a spread of investment that prioritises participation. It is an investment choice that prioritises income transfers. 6.2. A failure to prioritise early intervention to prevent young people falling NEET. 504. The welfare system has continuous contact with many of the children at highest risk of becoming NEET, often from an early age. The majority of those who get child DLA, for example, are awarded it by the age of 8. Note 514. Child DLA caseloads by age. Young People and Work Interim Report. Analytical Annex. Available at https://www.govt.uk/government/people-and-work-interim-report. And the text continues. Child benefit is paid from birth and dependent on their income, households continue to receive it, and the Universal Credit Child element for young people aged 16 to 20 enrolled in approved full-time education. Aside from prompts from a parent to report a young person leaving approved full-time education, there is no monitoring of attendance or contact with the young person. This is despite the fact that between 7% and 15% of the young people across qualifications approved for reporting in age 16 to 19 performance measures do not complete the main learning aim of their study programs. Note 515. A-level and other 16 to 18 results. Department for Education. www.gov.uk. Assessed 7th of May 2026. Available at https://explore-education-statistics.service.gov.uk/fine-statistics/A-level-and-2024-25 #section-retention. And the text continues. Prior to the age of 18, the welfare system's only objective is to support with living costs and help the child's household with additional costs, for example, of disability. Contact is about determining eligibility for benefit support, and unless a young person claims an out-of-work benefit, participation is not a topic of conversation despite the fact that 505. Those who receive child DLA and have an EHCP in place will have a NEET rate of 50% when they reach 22, versus 14% for children without child DLA or SEN provision. Note 516. Support for children with disabilities and special educational needs. IFS. ifs.org.uk. Published 2025. Available at https://ifs.org.uk/sites/2025-10%20 children with %20 disabilities %20 and %20 special %20 educational %20 needs %20 dash %20 green %20 budget %20 chapter.pdf. And the text continues. 68% of the 16 to 24 PIP caseload previously received disability allowance as children. Note 517. Composition of PIP caseload. PIP new claims v. former child DLA claims. February 2025. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. Over 2/3 of the child DLA claimants that move on to PIP will claim UC within 6 years of making a claim. Half of all child DLA to PIP claimants will claim UC Health. Note 518. Analysis of benefit claims for young people aged 16 to 24 who started their original claim to a health and disability benefit in 2019. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. 506. We might look at this and determine that the system is working to provide income and independence for young people who need it. Through the call for evidence and our engagement with disabled people's organisations, charities and young people themselves, it is clear that some disabled young people will never be able to work and face exceptionally high barriers to other forms of participation. The benefit system must always protect these groups. It is also overwhelmingly clear from this engagement and evidence that disabled young people want to participate and that many could with the right support, job, course or training. The benefit system must meet the needs of both those who may never work and those who desperately want to do so but currently are lacking a system designed to support participation. 507. By contrast, in Wales, Scotland and Northern Ireland, education maintenance allowance of between £30 and £40 per week provides further financial assistance to young people from low-income families who remain in education with payment based on regular attendance in school or college. The education maintenance allowance provides one means of preventing young people from disengaging from education early, but evidence of its impact is mixed. An IFS evaluation of the EMA in England showed that whilst it did increase participation in full-time education amongst lower-income 16 to 19-year-olds, this mainly came from students who would have been studying or training part-time. The evaluation also showed that there was no impact on attainment, and the policy may have slightly reduced earnings and employment in the longer term. Note 519. The short and long-run effects of the Education Maintenance Allowance, IFS, ifs.org.uk. Published February 2025. Available at https:///ema.mpo.final_0.pdf. And the text continues. 508. Nonetheless, in general, the welfare system treats many of its interactions with young people as administrative, rather than as early opportunities to intervene to prevent young people falling out of participation or falling further into disengagement. Nor does the welfare system work in sync with other key public services to maximise the labour market chances of young people. The education system, for example, requires people with an EHCP in place to undergo a Year 9 review to start planning for the young person's transition to adult life, covering employment, independent living and participation in society. This is positive, yet that review is not coordinated with the welfare system, which will in practice be the receiving institution for most neat people in the transition to adulthood. 509. A welfare system that was designed to promote participation would prioritise early investment in order to prevent young people falling neat, falling into long-term inactivity, and falling into expensive long-term benefit receipt. But this is not the welfare system we have today. 6.3. Insufficient practical help to enable young sick or disabled people into work. 510. Chapter 1 shows that at the centre of the current NEET challenge is more young people falling into economic inactivity due to ill health. Yet it is precisely this group who have least access to support to participate from the welfare system and who have absolutely no requirement to engage in any conversation or work-related activity. Those who are assessed to have the greatest barriers to work are placed in the limited capability for work-related activity LCWRA group in universal credit and have no conditionality or work expectations. It is little surprise that only 1 in 100 young people in the LCWRA group move into a job each month. Note 520. Interwork rates based on average interwork rate for September-November 2024 inclusive. Young People and Work Interim Report. Analytical Annex, available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. 511. A key opportunity to engage young people before they become long-term inactive is when they have identified themselves as having a health condition and are waiting for a work capability assessment. 48,000 young people are in this position currently. many waiting 3 months for an assessment. Note 521. UC Health Caseload, December 2025, DWP, stat-explore.dwp.gov.uk, accessed 28th of April 2026, available at https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals UC_WCA_ dot. And the text continues. Yet they receive the equivalent of only 1 to 2 minutes of work coach time each week. H. Work coaches have a flexible time bank of 22 minutes per quarter to provide additional support and advice for people in the pre-WCA and LCW parts of the UC health journey. And the text continues. In the vast majority of cases, all work-related requirements are also waived. 512. The fit notes received by young people awaiting a work capability assessment also fail to encourage participation at this stage in a young person's health journey. They are currently the only required interaction between the welfare system and the NHS, typically used as the evidence for placing people in the health journey and reducing their conditionality requirements. 93% of fit notes reported individuals were not fit for work. Very few identify the barriers that need removing to enable people to participate in the labour market or other opportunities to learn or train. Note 522. Fit notes issued by GP Practices, England, December 2025. gov.uk, www.gov.uk, published 23rd of April 2026. Available at https://data-information/fit-notes-issued-by-gp-December-2025. And the text continues. 513. The lack of support available is compounded by the increasing number of young people who are categorized as having limited capability for work or work-related activity. The Resolution Foundation found that the number of out-of-work young people who receive means-tested benefits and have no requirement to engage with employment support services has almost doubled from 160,000 in 2019 to 300,000 at the end of 2025. Figure 27. Note 523. Lost in transition. An examination of why the UK NEET rate is high and rising. Resolution Foundation. https://www.resolutionfoundation.org/. Published 28th of April 2026. Available at https://www.resolutionfoundation.org/app/uploads/2026/04/lost-in-transition.pdf. Figure 27. Number of 18 to 24-year-old benefit recipients in different conditionality groups. GB 2009/10 to 2025/26. Stacked area chart February 2010 to November 2025. Showing 4 UC claimant categories stacking to totals approximately 850,000 to 1,150,000. Intensive work search gold dominates throughout. Ranges 200,000 to 500,000. Work-related activity green, approximately 60,000 to 220,000 range. Sharp decline post-2018. Assessment phase, light blue, begins about 60,000. collapses to near zero 2018 onwards. No work requirements, mid-blue, begins low, about 100,000, rises to about 300,000 by 2025. Y-axis count in millions, 0 to 1.2. X-axis months, February 2010 to November 2025 at 3-month intervals. Graph reproduced from Resolution Foundation, Lost in Transitions report. Source: Resolution Foundation's analysis of DWP Stat Explore. Reproduced from Resolution Foundation, Lost in Transition, published April 2026. Notes: shows people on universal credit and recipients of job seekers allowance, employment and support allowance, income support, incapacity benefit and severe disablement allowance. All job seekers allowance recipients are shown in the intensive work search group. In reality, a small number may not have this requirement due to their specific circumstances. And the text continues. 514. Once personal independence payment PIP is taken into account, less than half of spending for young people across disability, incapacity and unemployment support has any participation support or requirements attached to it. Over time, that situation has become worse, not better. 515. Of course, PIP was designed to focus on the extra living costs that stem from disability or long-term health conditions, rather than actively improve participation. It is assessed through a functional assessment which measures the impact of a long-term health condition or disability on an individual's daily life. The functional assessment requires claimants to demonstrate they cannot undertake certain specific activities reliably, repeatedly and safely. If they receive sufficient points in the assessment, they will receive a cash payment intended to help with additional costs associated with not being able to complete these activities. It is not an assessment of their ability to work or the support they need to do so, and payment of the benefit is unrelated to employment status. 516. The way PIP works means that the considerable and growing resources devoted to it are not targeted on helping improve the functional capacity of disabled young people, and therefore enhancing their labour market or wider participation prospects. There is no consistent provision of practical support with daily living, occupational therapy, vocational rehabilitation, mental health social work, specialised coaching, workplace assistance, or links to the networks that would enable participation. And this despite the fact that many disabled claimants have needs and aspirations that the benefit system does not currently meet. For example, 69% are open to receiving contact from DWP about offers of support for employment benefits or disability services. Note 524. Work aspirations and support needs of health and disability customers. Final findings report, DWP, gov.uk, published 17th of July 2025. Available at https://www.gov.uk/government/publications /work-aspirations-and-support-needs-of-health-and-disability-customers-final-findings-report /work-aspirations-and-support-needs-of-health-disability-customers-final-findings-report -2. And the text continues. 517. It is of course essential that the benefit system plays a role in supporting young disabled people to live independently. That is not in question in this review. Equally, it is clear that independent living and labour market participation are not exclusive. The latter, for many, is a fundamental component of the former, creating networks, confidence and income. For many others, the ability to live independently, to travel for example, is crucial to their ability to participate in work. 518. PIP is the welfare system's first point of contact with disabled young people from the age of 16, and for many it is the only point of contact before an out-of-work claim. But as PIP is not designed to consider participation outcomes, the participation status of the claimants is not routinely captured, monitored or published. Analysis we have undertaken, however, does not suggest that it is achieving good participation outcomes. Administrative data shows that PIP claims are getting longer in duration, with 87% of 16 to 24-year-olds in the 2019 cohort still on the benefit 5 years later, compared to 74% of the 2013 cohort. Note 525. Duration of health and disability benefit claims. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. Only 25% of young people in receipt of PIP at age 24 are in work. Note 526. PIP caseloads 16 to 24 by education or employment status. March 2024. Young People and Work Interim Report. Analytical Annex. Available at https://www.government/government/people-and-work-interim-report. And the text continues. The employment prospects of a young person claiming PIP get 21% worse over 6 years, whereas for everyone else they get 31% better. Note 527. Employment outcomes for PIP claimants. Young People and Work Interim Report. Analytical Annex. Available at https://www.government.uk/government/people-and-work-interim-report. And the text continues. 519. Between the ages of 16 and 18, most PIP claimants engage in some form of education, 86%, while the proportion not in work or education/training is only 12%. From age 19, the NEET rate increases rapidly, reaching around 2/3 by age 24. The data makes it clear that PIP does nothing to support this key point of transition from education to work. Note 528. PIP caseload 16 to 24 by education or employment status. March 2024. Young People and Work Interim Report. Analytical Annex. Available at https://www.government.uk/government/people-and-work-interim-report. And the text continues. At no point in a young person's application or journey on PIP are they asked about or supported to work. This is not an accident of delivery. It is how PIP is designed. 520. It is a symbol of a wider failure on the part of the benefit system to provide practical help for sick and disabled youngsters into work. The consequence is that a disabled person who seeks support is offered a benefit assessment, not a conversation about their goals, their struggles, the support around them and the help they need. The system measures functioning. It does not plan for improving it. It asks what a young person cannot do. It does not ask what they could do, with the right support, or what they want to do. It measures what someone cannot do and writes a check. It does not ask what they could do and build a plan. The benefit system is founded on a deficit model of disability, one that pays for what a young person cannot do rather than investing in what they could become. 521. The government is taking action to address that deficit. Its Youth Guarantee and Pathways to Work are both welcome investments and actions, but they must go further. The Youth Guarantee amounts to an impressive support package for most unemployed young people, but it is yet to be tailored to those who are economically inactive due to a health condition. The Youth Jobs Grant is at the same level whether an individual has been unemployed for 6 months or inactive due to a health condition for 2 years. The Jobs Guarantee, which provides subsidised work for those unemployed for 18 months, is only there for young people in the intensive work search group, not anyone on UC Health. And while the investment in pathways to work, personalised support for those who are sick and disabled is an important step, young people require a programme specifically designed and tailored for their needs. Without further investment, it will likely, under the current system, reach only a small fraction, in the low tens of thousands, of the 290,000 young people who are out of work and on health and disability benefits. Note 529. Not working on UC Health from UC Health Caseload, December 2025. DWP stat-explore.dwp.gov.uk. Access 28th of April 2026. Available at https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals UC_WCA_case. Not working on PIP only from PIP caseloads 16 to 24 by education or employment status, March 2024. Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. There is a long way before young, sick and disabled people are properly enabled to work. 6.4. How support is provided does not fit the needs of sick or disabled young people who are job seeking. 522. For the 380,000 young people in the intensive work search conditionality group, more support is given. Note 530. People on Universal Credit Statistics, March 2026. DWP stat-explore.dwp.gov.uk. Accessed 5th of May 2026. Available at https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals UC_monthly. And the text continues. Job Centre Plus is delivering for many young people. 69% of under 25-year-olds on UC who are not working and had recently been supported by a work coach felt supported by their work coach to prepare for work or move into employment, compared to 54% for 25 to 49-year-olds. Note 531. Universal Credit Survey, Data on Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. The problem is that Job Centre Plus work coaches carry high caseloads and work within a regime and setting that make genuine personalisation especially required for disabled young people, those with health conditions and those with additional needs, extremely difficult. 523. Job Centre work coaches typically manage 100 unemployed claimants. Note 532. Supporting people to work through job centres. nao.org.uk. Published 31st of March 2025. available at https://www.nao.org.uk/supporting-people-2025/through-jobcenters.pdf. And the text continues, and have an expectation that they see each person for 10 minutes every week or fortnight. In that session, they need to review activity, check compliance and set new activities for the following weeks. This does not give enough time to understand the specific barriers facing, say, a 20-year-old with autism and anxiety who has never worked, lives in a rural area with no transport, and left college without completing a course. 524. The mainstream UC system is built around rapid movement into any available job. For an older worker between roles, that may be appropriate. It may not be for a young person with a health condition, low qualifications, no work history, and limited confidence. Support to get onto an effective education track or training pathway is secondary and not actively incentivized. As a result, many young people cycle between short-lived, low-quality jobs and repeat benefit claims without ever establishing a sustained footing in the labour market. 525. The Job Centre Plus experience can itself be a barrier. Young people enter a security-guarded environment and encounter conditions and rules designed for a different population. The call for evidence found this consistently. The first interaction with the welfare system is experienced as confusing and procedural rather than supportive. Young people told this review that the experience felt like being in trouble rather than being helped. One described it as walking into a place where they already think you're not trying. 526. The Youth Hubs model provides a different kind of environment, informal, co-located, staffed by people trained to work with young people, designed around encouragement rather than enforcement. The evidence shows it works better. The government is rightly rolling out this approach, but whilst expansion is taking place, coverage is currently patchy and the mainstream job centre remains the default entry point. Note 533. Youth Offer Process Evaluation, DWP, gov.uk, published 7th of October 2024. Available at https://www.gov.uk/youth-offer-process-evaluation. And the text continues. 6.5. Incentives and processes make participation less attractive for many young people. 527. All social security systems differentiate support and expectations according to people's health and disabilities. Some young people will never be able to work, while others will only be able to work with substantial support. A welfare system in a civilized country must recognize those realities and provide support. 528. The main problem is how that additional support is structured in universal credit. It is designed in ways that can drive young people into passive inactivity rather than into them actively seeking work. For a young person with a health condition who is unemployed and potentially seeking work, taking a pathway to inactivity can offer higher income, less hassle and lower risk. This is a perverse incentive that is the polar opposite of what a participation-first welfare system should be providing. 529. Universal credit operates a binary financial structure for young people with health conditions. A single young person with no dependents or housing costs, assessed in a work capacity assessment as fit to work or since 2017, having limited capability to work, received £316.98 per month in 2025/26. If that person received the limited capability for work-related activity element, they would get £740.25, significantly more than double. Note 534. Benefit and pension rates 2026 to 2027-DWP.gov.uk. Published 16th of February 2026. Available at https://www.gov.uk/benefit-and-pension-rates-2026-2-2027. And the text continues. The financial incentives for the young person are clearly stacked in favour of choosing a path to inactivity, not participation. 530. The government has already begun to rebalance financial incentives. Starting in April 2026, it legislated to increase the standard allowance by above inflation to 2029/30, providing an estimated extra £662 per year in cash terms, around £255 above inflation, for individuals under 25 by 2029/30. 531. The LCWRA element has been reduced from £430 to £217 per month for most new claimants, and will be frozen until 2029/30. This means that this year a new single under 25 claimant with no housing costs or dependents will be £217 better off with the LCWRA element, a 64% increase above the standard allowance alone, compared to an increase of 134% for similar claimants in 2025/26. 532. This rebalancing makes the health journey significantly less financially attractive. 533. But incentives at entry are not just about differential rates. The sharp contrast in conditionality between the two regimes also plays a significant role. Young people found fit for work can be required to search for work full-time, meet the terms of their claimant commitment, and attend a face-to-face appointment once a week or fortnightly. If they miss this appointment, they can be sanctioned up to 100% of their benefit payment. By contrast, many young people on the health journey have no regular personalised engagement. 534. The incentives claimants face at entry have an effect on young people's participation rates. The OBR has concluded that the difference in conditionality between LCWRA and intensive work search is likely to have been a driver of the increases in health benefit claims. Note 535. Welfare Trends Report, October 2024. OBR, obr.uk. Published March 2024. Available at https://obr.uk/uploads/welfare-trends-report-october-2024.pdf. And the text continues. In principle, claimants can be placed in the limited capability for work regime, which allows people with health conditions to be supported to prepare for work. This regime has some conditionality and allows claimants to keep some of their earnings before their benefits reduce. Initially, this was alongside a smaller increase in financial support than those deemed LCWRA. In 2017, this financial support was removed, making the system more binary and increasing the incentive for people to be counted as LCWRA. Now, nearly 85% of young people on the health journey post-WCA are in the LCWRA group, where income is higher and all work-related requirements are suspended. Note 536. Caseload numbers from UC Health Caseload, December 2025. DWP stat-explore.dwp.gov.uk. Access 28th of April 2026. Available at https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals UC_WCA_case, and the text continues. The system has turned into a binary choice between looking for work on very little money with heavy conditionality and not looking for work on more money with no requirement and no support. 535. Once in the UC health journey, the risks of taking on work often feel overwhelming to claimants. On paper, those on the UC health journey could be much better off in work as they retain the UC health element and have a work allowance, which means their benefits don't reduce for the first £427/£710 they earn per month, dependent on housing costs. However, this is only the case if a claimant continues to count as having limited capability for work or work-related activity. For many, believing that moving into work won't mean they lose a benefit paid on the basis of their inability to work is a stretch too far. Claimants often fear serious financial consequences if they get a job, and it does not work out. Nearly half of health and disability claimants who were not in work and did not rule out work permanently were worried that they would not get their benefits back if they tried paid employment and it failed. Note 537. Work aspirations and support needs of health and disability customers. A focus on young people. See accompanying analytical annex. https://www.gov.uk/government/people-and-work-interim-report. And the text continues, as one mental health organisation put it. Many people with mental health problems tell us that one of the biggest barriers to even considering work is the fear that trying a job, even for a short period, could put their entire financial security at risk. 536. Figure 28 shows the different scenarios an individual currently receiving PIP and LCWR needs to consider when looking for work, including the fear that they will lose all state support. The probability of this is low, but the fear is not. Figure 28. Scenario-based analysis of comparative earnings under different job search and employment outcomes for an individual on PIP and LCWRA benefits. The probability of losing all state support is low, but the fear is not. Horizontal bar chart showing monthly income across 4 scenarios for a person currently receiving disability benefits based on average local housing allowance rental costs. The current situation bar blue shows £1,978 per month. If the job works out, green, income rises to £2,531, an increase of £553. If the job fails and the health and disability benefits are lost, grey, income falls dramatically to £852, a loss of £1,679 from the current position. The fourth scenario, labelled what many fear, red, shows £0, representing complete loss of income. Scenario labels appear above each bar with values and changes shown on the right. The chart illustrates the severe financial risk faced by disabled people considering employment, where a failed job attempt could leave them significantly worse off than staying on benefits. Source: Net Income Case Study of Young Person with Average Rent, Young People and Work Interim Report, Analytical Annex. Note: In-work earnings calculations calculated based on 35 hours at national minimum wage. Includes average LHA rental costs and CTR relief based on Leicester City Council scheme. Scenarios: today, Universal Credit Standard Rate, New Rate LCWRA, Housing, Maximum PIP and Council Tax Reduction. If the job works out, earnings maximum PIP LCWRA is lost at next reassessment and universal credit tapered away. If the job fails, standard universal credit and housing only, no PIP, no LCWRA. What many fear, no state support. And the text continues. 537. Disability-related benefits like personal independence payment and passported support can together represent a substantial and stable income package, particularly once housing support is included. Claimants' total effective income can be in excess of £2,000 per month. These are significant sums to put at risk. 538. Once lost, it can be a difficult or impossible journey back to the original financial position. There is no guarantee a claimant will be awarded PIP or UC health following new assessments if a full-time job does not stick. Once claimants weigh up the risks of being substantially worse off compared to not trying at all, it is understandable that so many feel they have no choice but to take the latter non-participation route. Over 1/3, 37% of all people claiming PIP but not UC health worry about losing their benefit if employment doesn't work out. Note 538. Work aspirations and support needs of health and disability customers. Final Findings Report, DWP, gov.uk, published 17th of July 2025. Available at https://work-aspirations-and-support-final-findings-report-2. And the text continues. 539. The features of this system also combine to make part-time work unattractive for claimants, because the financial signal for trying small amounts of work is weak at the point a claimant is deciding whether to engage. Figure 29 shows that a single 18 to 20-year-old claimant on the under 25 UC standard allowance who works 10 hours a week at the minimum wage would have total monthly income of £551 under ordinary UC rules. By contrast, a new claimant receiving the lower UC health element would receive almost the same amount, about £556 a month, without working or having any requirements to actively take steps towards work. That does not mean work never pays. If a claimant keeps the health element while working, they will be materially better off. But claimant uncertainty about what their financial position will be if they try work makes part-time work less attractive. Figure 29. Comparison of income from 10 hours of part-time work for a 20-year-old compared to health and disability-related benefits, 2026/27. Dot plot comparing monthly net income across 6 income support scenarios for young people. Universal Credit Standard Allowance provides £339 monthly, while 10 hours at the minimum wage yields £551. UC Health Allowance at the new rate is £556 compared to £768 at the old rate. Adding the highest personal independence payment, PIP, to UC Health Allowance increases income to £1,402 new rate or £1,615 old rate. A dashed reference line marks the UC Health new rate at £556. Source: Net Income Case Studies by Earning and Benefit Receipt. Young People and Work Interim Report. Analytical Annex. Note: Earnings for 10 hours at National Minimum Wage, NMW, exclusive of any health entitlement. And the text continues. 540. This matters because part-time work is often the first confidence-building step that young people need to transition into full-time work. While the system permits part-time work, it does not provide effective encouragement of it. For a young person who has never worked, who has spent months at home, who is managing anxiety that makes leaving the house difficult, the idea of moving straight from inactivity to a full-time job is terrifying. What they need is an intermediate step, a few hours volunteering, a supported work taster, a part-time role with gradual escalation, a placement where failure does not mean financial catastrophe. The system does not promote this. For young people with fluctuating conditions, the absence of strong support for intermediate measures is particularly destructive. They need a system that accommodates variation, that allows for them to build up gradually, that treats a setback as a normal part of recovery. 541. The government has made a positive step through the right to try regulations, which provide that paid or voluntary work will not, in and of itself, trigger a reassessment, but this is not a full guarantee that a claimant's wider position cannot be revisited if other evidence suggests a relevant change in circumstances. 542. Nor does it address the system's fundamental design flaws. The current system requires young people to demonstrate they cannot function or work in order to access the highest levels of financial support, rather than starting from trying to help them participate. And for a young person unemployed and with a health condition, once on the benefits, the path to employment comes with higher risk and, in some circumstances, lower income. In the long run, for the average claimant, it is true that they will be better off in full-time work, but the risks posed by getting there are often sufficient to deter all but the most determined. 6.6. Assessment processes are locking in permanence on benefits. 543. The welfare system for young people today is dominated by those with mental health and neurodevelopmental conditions. The vast majority, 8 in 10, young people on UC Health now report having a neurodevelopmental or mental health condition when they undertake a work capability assessment. Note 539. Conditions reported at YCA, Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. 544. Today, nearly half of PIP claims among young people are for autism and ADHD, compared to less than 1 in 10 for all PIP claimants. Figure 30. The numbers have been rising steeply over recent years. The combined share of anxiety or depression, autism and ADHD reported as the primary condition for 16 to 24-year-olds claiming PIP has risen from 49% in January 2020 to 64% by January 2026. Figure 31. Note 540. Caseload data from PIP. Cases with entitlement. DWP. https://stat-explore.dwp.gov.uk/webapi/JSF/data catalog explorer.xhtml. Access 23rd of April 2026. Available at https://stat-explore.dwp.gov.uk/webapi/open info page ?ID equals pip_monthly_new. Figure 30. Primary health condition for PIP claimants in January 2026. Source: DWP, PIP cases with entitlement, stat-explore. Stacked bar chart comparing the composition of the PIP caseload by primary health condition for the total caseload and for ages 16 to 24 specifically. as of January 2026. Each bar sums to 100%. In the total caseload, MSK disease accounts for 31%, anxiety and depression for 19%, autism for 6%, and learning disabilities for 5%. In the 16 to 24 age group, autism dominates at 36%, followed by anxiety and depression at 16%, ADD/ADHD at 13%, and learning disabilities at 12%. Mental health and neurodevelopmental conditions together account for approximately 77% of the 16 to 24 caseload, compared to approximately 33% of the total caseload. Conditions such as MSK disease and neurological disease are proportionally much smaller in the younger age group. Source: DWP. PIT cases with entitlement. Stat-Explore. Note: data labels for values less than 2% have been suppressed. And the text continues. 545. These conditions often fluctuate. Research has consistently shown that even severe mental illness is not always a lifelong or even chronic condition. Many people with severe mental illness have a reduction of both symptoms and associated secondary impairments over time, with a range of interventions, including supported employment, being effective in supporting recovery. Note 541. Whitley, Rob, Palmer, Victoria and Gunn, Jane. Recovery from severe mental illness. CMAJ 2015, September 22, 187, open brackets 13, close brackets. Published September 2015. Available at https://pmc.ncbi.nih.gov/articles/PMC4577336/. And the text continues. A young person with anxiety or depression may be unable to attend an interview on Tuesday and be capable of working on Thursday. ADHD does not present the same way every day. Autistic young people can thrive in the right environment and collapse in the wrong one. We heard compelling evidence from Amazon, for example, about the success of its programs employing young people with autism. And as the Fonagy Interim report indicates, a diagnosis of a neurodevelopmental condition or anxiety and depression should not automatically trigger a verdict that a young person is unable to work. Note 542. Independent review into mental health conditions, ADHD and autism. Interim report. gov.uk. www.gov.uk. Published 31st of March 2026. Available at https://assets.publishing.service.gov.uk//69cd-b-db-23692d81b3f213c660/ independent-review-into-mental-health-conditions-ADHD-and-autism-interim-report.pdf. And the text continues. These are not conditions that lend themselves to a binary judgment of able to or not able to undertake certain activities, but this is the only decision that the benefit system's current rules takes. 546. The work capability assessment effectively treats current incapacity as static in a way that does not match the reality of many young people's fluctuating or changing conditions. The system considers the severity of a health condition or disability as it presents today, rather than the potential to improve and expand functioning. That locks in young people to greater permanence on benefits, even when the majority of them have conditions that can and do change. 547. Worse still, processes to reassess claimants' conditions have been progressively weakened since the pandemic. Reassessment was meant to be the mechanism for keeping pace with people whose functioning had changed and ensure prognoses were taken into account. Historically, reassessment was one of the main routes off the health journey. Pre-pandemic, it accounted for around a third of all off-flows. Note 543. Welfare Trends Report, October 2024. OBR, obr.uk. Published March 2024. Available at https://obr.uk/welfare-trends-report-october-2024.pdf. And the text continues. Reassessments were paused during COVID-19 and have not been restored to anywhere near their previous level. Today, outstanding WCA reassessments stand at nearly 2 million. Note 544. WCA reassessment backlogs. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. The implication of a 2 million backlog is that a large number of people whose conditions may have improved are not being asked about it, and those who are worsening are not getting additional support. 548. Face-to-face assessment which produces different and generally tighter outcomes than remote assessment. Note 545. Health and disability benefits. Improve operations by increasing face-to-face assessments. Increasing WCA reassessment capability and PIP award review changes, starting from April 2026. Costing. Budget 2025 Policy Costings. HMT. Gov.uk. Published November 2025. Available at https://assets.publishing.service.gov.uk/media/692872FD2A 37784B16EC F676/budget_2025-policy_costings.pdf. And the text continues. Fell sharply over the same period and has only recently begun to recover. This is not merely an administrative change. It is a weakening of the system's ability to understand the young people it is supposed to serve and to enable them into work. It is welcome that the government has announced plans to increase face-to-face assessments and to eat into the reassessment backlog. But in truth, the damage is done. The weakening of the assessment framework has contributed to more young people being stuck inside the benefit system for longer, with lower levels of support and fewer expectations about getting into work. 549. The numbers tell the story. Since the Work Capability Assessment was first introduced in ESA, the legacy incapacity benefit that preceded the UC Health Journey, the rate of initial WCAs resulting in an award has risen from 39% in May 2010 to 73% in May 2019, and has remained high ever since. Note 546. Welfare Trends Report, October 2024. OBR, obr.uk. Published March 2024. Available at https://obr.uk/DLM_uploads/welfare-trends-report-october-2024.pdf. And the text continues. The composition has shifted too. The share of incapacity benefit claims placed in the support group /LCWRA group for initial assessments, where there are no work-related requirements at all, has gone from 22% in May 2010 to 66% today. Note 547. 2025 data. UC-WCA decision outcomes. DWP. stat-explore.dwp.gov.uk. Accessed 05/05/202. Available at https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals UC_WCA_DEC. 2010 data. ESA-WCA by date of decision. DWP stat-explore.gov.uk. Access 05/05/2026. https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals ESA_WCA_JR. Date for initial assessments only. Available at https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals UC_WCA_DEC. 2010 data. ESA-WCA by date of decision. DWP stat-explore.gov.uk. Accessed 05/05/2026. Available at https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals ESA_WCA_JR. Data for initial assessments only. And the text continues. The original policy intent was to use the LCW group as an intermediate category, with limited conditionality and active support to prepare for work. In practice, the system bypasses LCW. The vast majority of health claims now move into the no expectations, no requirements and no engagement group. 550. For young people, the consequences are now visible in the duration data. Off-flow rates have fallen cohort by cohort and have plateaued across all cohorts at the point reassessments were paused and COVID-era rules relaxed. Figure 32 shows how 7 in 10 young people claiming a health and disability benefit are still claiming a decade later. Over only 10 years, 2010 to 2020, the proportion of young people leaving disability benefits within 5 years dropped by 40%. Note 548. Duration on health and disability benefits. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/young-people-and-work-interim-report. And the text continues. Similar patterns are observed for those claiming PIP. Figure 33. 551. The system has become stickier and stickiness compounds. Every additional year a young person spends on the caseload reduces the probability they ever leave it. Figure 32. Percentage of claimants remaining on incapacity benefits over time by cohort year first claimed. Line chart showing the percentage of young 16 to 24 claimants still on the incapacity benefit caseload at each year from 0 to 10 years after first claiming. For 6 cohort years, 2010, 2012, 2014, 2016, 2018 and 2020. All cohorts start at 100% and decline over time. The y-axis begins at 60% to emphasize variation between cohorts. Earlier cohorts from 2010 and 2012 showed the steepest declines, falling to approximately 62 to 67% by year 10. The 2014 cohort falls around 71% by year 10. The 2016 and 2018 cohorts show a flatter trajectory and remain at higher levels, around 75% and 79% respectively at their last observed data points. The 2020 cohort, which has only 5 years of data, remains at approximately 84% at year 5, substantially higher than earlier cohorts at the same duration. Later cohort years end before year 10 as the data is not yet available, with cohort labels shown at the end of each line. Source: Duration on Health and Disability Benefits, Young People and Work Interim Report, Analytical Annex. Figure 33. Percentage of claimants remaining on PIP over time by cohort year first claimed. Spaghetti line chart showing the percentage of claimants remaining on PIP for up to 10 years by the year they first claim, cohorts 2013 to 2024. All cohorts show very high retention, with most remaining above 70% after 10 years. Later cohorts show even higher retention in their initial years. Each line is a different shade of green, with labels at the end of each line indicating the cohort year. Source: Duration on Health and Disability Benefits, Young People and Work Interim Report, Analytical Annex. And the text continues. 6.7. Participation outcomes for young people are deteriorating. 552. These 6 fault lines in the welfare system compound to deliver poor participation outcomes for young people. Significantly, participation outcomes are actually worsening. 553. Movement into work collapses for those on the UC health journey. For young people who are in the LCWRA group, only 1 in 100 move into work each month, compared to around 1 in 10 for those in the intensive work search group. Note 549. Into work flow rates by conditionality group. Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. 554. While young people overall see a steady increase in the employment rate as they age, move out of education and gain experience, young people on health and disability benefits do not. At 24, only a quarter of people in receipt of PIP are in work. For young people continuously receiving PIP, the employment rate falls as they age, leading to the gap between them and their peers to double. Figure 34. Figure 34. Employment rate over time of everyone aged 18 to 24 and those awarded PIP for the full period, 2018 to 2024. Line chart showing monthly employment rates from April 2018 to March 2024 for 2 groups of 18 to 24-year-olds. All 18 to 24-year-olds in 2018/19 green shows a rising trend throughout, starting at 61% in April 2018 and reaching 80% by March 2024. Those who are on PIP continuously as 18 to 24-year-olds in 2018/19 yellow start at 35% employment and decline steadily to 27% by March 2024, widening the gap with the general population over time. Source: Evidence on long-term outcomes for health and disability benefit claimants. Young People and Work Interim Report, Analytical Annex. And the text continues. 555. This disengagement from participation continues long-term. Of those first claiming a health and disability benefit aged 16 to 24, whether PIP or UC Health, 48% are not in work or education 15 years later. 5 years after first claim the figures is 53%, 10 years after 51%, Figure 35. The participation curve plateaus. Note 550. Evidence on long-term outcomes for health and disability benefit claimants. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/young-people-and-work-interim-report. Figure 35. Percentage of young people on health and disability benefits who are not in education and training 15 years after their first claim. Line chart with data points showing the percentage of young people not in employment or education at each year from 0 to 15 years after their first health or disability benefit claim. The 16 to 24 group starts at 50.1% at the point of claiming, rises to a peak of 56.6% in year 1, then gradually declines to 47.9% by year 15. Roughly half of all young people who have ever claimed a health or disability benefit remain outside employment and education even 15 years after their first claim. Source: Evidence of long-term outcomes for health and disability benefit claimants. Young People and Work Interim Report. Analytical Annex. And the text continues. 556. Successive cohorts of young people are doing worse than their predecessors. Among 16 to 24-year-olds first claiming a health or disability benefit in 2010, 46% were out of work or education 5 years later. For those who first claimed in 2019, the figure is 62%. Figure 36. Figure 33 shows that PIP persistence is lengthening on the same timetable. 74% of the 2013 cohort was still on the caseload after 5 years. 87% of the 2019 cohort were. Incapacity persistence has done the same. 68% of the 2014 cohort were still claiming after 5 years. 84% of the 2020 cohort were. A young person first claiming health and disability benefits in 2019 is 34% more likely to be NEET after 5 years than those first claiming in 2010. Note 551. Evidence on long-term outcomes for health and disability benefit claimants. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/young-people-and-work-interim-report. Figure 36. Percentage of young people NEET 5 years after their first health benefit claim. Bar chart showing the percentage of 16 to 24-year-olds who were not in employment or education 5 years after making their first health benefit claim by year of first claim from 2010 to 2019. The NEET rate rises consistently over the period, from 46% for those who first claimed in 2010 to 62% for those who first claimed in 2019. Each bar is labelled with the exact percentage. The upward trend suggests that successive cohorts of young health benefit claimants face increasingly poor long-term employment and education outcomes, with nearly 2/3 of the 2019 cohort still NEET 5 years later. Source: Evidence on long-term outcomes for health and disability benefit claimants. Young People and Work Interim Report. Analytical Annex. And the text continues. 557. 3 different measures are all moving in the same direction within 5 years. Each successive cohort stays longer on benefits. Each is less likely to move into work and receives less support. This is a catastrophic systems failure that scars the life chances of thousands of young people. 6.8. The financial cost. 558. The personal cost is paid by the individual young person. As we outline in Chapter 8, the long-term scarring effect of being NEET and stuck economically inactive in the benefit system is corrosive of life chances. 559. There are also growing consequences for the public finances. The scale of health and disability benefit receipt among young people has increased significantly over recent years. From August 2012 to August 2025, the number receiving incapacity benefits ESA or UC Health has increased from around 120,000 to approximately 250,000. The overall spend on UC for young people on the health journey has almost doubled from £1.3 billion to £2.1 billion between 2019/20 and 2024/25. Note 552. Estimated spend on 16 to 24-year-olds for PIP and UC 2024/25. Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/young-people-and-work-interim-report. And the text continues. 560. The number of 16 to 24-year-olds receiving DLA or PIP has risen from around 200,000 in 2012 to over 400,000 today. By 2031/32, we expect 700,000 young people to be receiving it. In 10 years' time, 820,000. 11% of all young people in the UK. Note 553. PIP caseload and expenditure forecast for young people. Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/government/people-and-work-interim-report. National Population Projections 2024 based ONS, ons.gov.uk, published April 2026, available at https://www.ons.gov.uk/people, population and community /population and migration /population projections /bulletins /national population projections /2024 based. And the text continues. This means that without intervention, a further 310,000 young people are expected to be on PIP in 10 years. Staggeringly, the number of young people claiming PIP is expected to quadruple over just a quarter of a century from 2012 to 2037. Note 554. PIP caseload and expenditure forecast for young people. Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. 561. The increase in disability prevalence in society is slower than the growth in disability benefit receipt amongst children. Disability prevalence for children has risen from 8% in 2018/19 to 12% in 2024/25. Note 555. Family Resources Survey, Financial Year 2024 to 2025, DWP, gov.uk, published 26th of March 2026, available at https://www.gov.uk/government/statistics/family-resources-survey-financial-year-2025 /family-resources-survey-financial-year-2024-2-2025 #disability-1. And the text continues. But since the start of 2019, child DLA claims have nearly doubled, from 450,000 in February 2019 to 860,000 in August 2025. Note 556. Support for Children with Disabilities and Special Educational Needs, IFS, ifs.org.uk, published October 2025. Available at https://ifs.org.uk/publications/support-children-disabilities-and-special-educational-needs. Growing Pressures, Exploring Trends in Children's Disability, Resolution Foundation, www.resolutionfoundation.org, published 17th of August 2024. Available at https://www.resolutionfoundation.org/app/2024/08/growing-pressures.pdf. And the text continues. The impact of this increase in child disability benefits is also seen well beyond a young person turning 16, as the proportion moving through the benefit system from child DLA as a child to PIP as an adult is rising. Around 8 in 10 child DLA claimants who apply for PIP are successful. Note 557. PIP reassessment outcomes for child DLA claimants. Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/young-people-and-work-interim-report. And the text continues. The pipeline of people moving into the non-participation part of the benefit system is growing. 562. The overall caseload of PIP claimants is expected to rise to 5.4 million by 2030/31. Note 558. Outturn and Forecast Tables, Autumn Budget 2025, DWP, gov.uk, published 29th of January 2026. Available at https://government/publication/full-publication-full-publication-update-history. And the text continues. The IFS report that growth in overall health-related benefit spend is likely to lead the UK moving from being one of the lowest spenders on health benefits in the OECD in 2019 as a proportion of GDP to one of the highest spenders by 2028. Note 559. Health-related benefit claims post-pandemic. UK trends and global context. IFS, ifs.org.uk. Published September 2024. Available at https://health-related-benefit-claims-post-pandemic-3-1.pdf. And the text continues. 563. Annual PIP expenditure for 16 to 24-year-olds rose from approximately £1.3 billion in 2019/20 to around £3.2 billion in 2024/25. In 5 years' time, we estimate that personal independence payments on the current trajectory will have further doubled in cost to £6.5 billion and cover 700,000 young people. Note 560. PIP caseload and expenditure forecast for young people. Young People and Work Interim Report, Analytical Annex, available at https:// www.gov.uk/government/publications/young-people-and-work-interim-report. And the text continues. For an investment of this scale in the lives of nearly 750,000 young people, the government might reasonably expect that those resources could help to deliver improved participation as well as independence outcomes. But they are not. 6.9 Conclusion 564. This chapter review tells a story of system failure. The state spends approximately £8 billion a year on PIP and universal credit for young people. For that investment, claimants are getting worse outcomes with every passing year. 565. Young people are not the same as older workers. The system has treated them as though they are. It is not just that the health conditions that young people face are markedly different from the health conditions that older people face. Their needs are different too. An older worker who develops a disability in mid-career has decades of experience behind them. Established habits, routines, professional identity, financial reserves and networks. Their relationship with the labour market is disrupted but not absent. Income replacement during a period of ill health is appropriate and proportionate. The system was designed for this person. A young person at 19 has none of that. No work history, no professional identity, no savings, no networks, no experience of managing in a workplace. They're not returning to something. They're trying to reach something for the first time. The critical need is support to make the first transition into work, yet the system makes no such distinction. 566. The state must continue to provide a financial safety net and help people, particularly those with disabilities, who may have extra costs or never be able to work. But for young people, that cannot be where the role of the welfare system ends. It must also give those who can participate a real chance to do so. Whilst this government is taking positive steps with the new youth guarantee and pathways to work, the system remains too focused on what a young person cannot do and too weak at helping them move towards what they may yet be able to do. It measures and in some cases encourages incapacity, but does too little to support capability. 567. If the welfare system continues in this form, the result will be much the same as it is now. Too many young people spending too long out of work or learning, poorer prospects over time, and a rising benefit bill because the state is paying for failure late rather than preventing it earlier. If current trends persist, we expect 1 in 20 of today's 5-year-olds will be on incapacity benefit at 22. More than one child in every class. Note 561. LCWRA caseload and expenditure forecast for young people. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. National Population Projections 2024 based. ONS. ons.gov.uk. Published 28th of April 2026. Available at https://www.ons.gov.uk/people, population and community /population and migration /population projections /bulletins /national population projections /2024 based. And the text continues. For a generation of young people whose adult lives are being shaped by this system, that is not good enough. It must change. 568. Welfare reform on its own will not solve the crisis in youth participation, but nor will reforms in schools, skills, health and work succeed if the welfare system continues to pull in the opposite direction. These reforms need to reinforce each other. A welfare system that supports participation must be part of that wider shift if the welfare state is to become a working state. This concludes Track 7. Track 8. This track is approximately 50 minutes long. Chapter 7. The Architecture. A System in Name, Not in Design. 569. There is no system in Britain that takes young people from education into work as adults. There are institutions, programs, and many good intentions, but there is no actual system. 570. Britain does not lack organisations with a role in supporting young people. It lacks a coherent participation system designed to ensure they make a supported and sustained transition into adulthood. Understandably, responsibility is dispersed across many organisations, but shared accountability is missing. Incentives are misaligned. Support ends at arbitrary boundaries rather than following a young person's needs. As a result, hundreds of thousands of young people receive inconsistent or no support. 571. This chapter sets out how that architecture fails. The argument follows a specific sequence, and each failure reinforces the next. Too many institutions have partial responsibility, but there are no shared outcomes. National and local delivery are confused and are becoming more complex. There is next to no focus on destinations. Funding has been cut, and what remains rewards numbers, not progression. Services do not integrate, and data does not flow. Local performance varies widely, and there is a stark post-18 cliff edge in tracking and support. 572. Together these failures help explain why, despite sustained effort over more than 2 decades, Britain has been unable to drive NEET rates down durably. No amount of reform to individual policy areas or institutions alone will fix this. The architecture itself is the problem. 7.1. Too many cooks. 573. The architecture in England that supports young people who are NEET or at risk of becoming NEET involves a bewildering number of institutions. There is no common mechanism to guarantee a smooth and successful transition for young people from education to employment. 574. In this crowded space there are schools, colleges, local authorities, strategic authorities, Job Centre Plus, DWP, integrated care boards, child and adolescent mental health services, CAMS, GPs, Skills England, the Careers and Enterprise Company, youth services, voluntary organisations, youth hubs, housing providers, special educational needs and disabilities, SEND teams, and more. The Local Government Association has identified over 50 different national programmes led by 17 different public bodies holding some responsibility for tackling economic inactivity. Note 562. Pathways to Work Commission Report, Barnsley Council, www.barnsley.gov.uk, published July 2024, available at https://www.barnsley.gov.uk/media/pathways-op-bp/pathways-2-work-commission-report.pdf. And the text continues. In one town, Barnsley, that spaghetti soup comprised over 70 local organisations doing the same. Note 563. Pathways to Work Commission Report, Barnsley Council, www.barnsley.gov.uk, published July 2024, available at https://www.barnsley.gov.uk/media/opbpxxkz/ bmbc-pathways-2-work-commission-report.pdf. And the text continues. 575. Different institutions have different remits. It is inevitable that no single one can hold the ring on everything from early years to benefit payments. The problem is that each part of the system operates within its own funding stream and accountability framework. When a young person begins to struggle, they do not encounter a coordinated response. They encounter separate systems operating in sequence, each with partial visibility and limited responsibility for what happens next. A school may identify the risk but not carry responsibility beyond exit. A college may record withdrawal but not own a re-engagement. A GP may recognise deterioration but not trigger the education and employment response. A job centre may only become involved if a benefit claim is made. Each institution performs part of a function. Fragmentation does not produce a cohesive response. 576. East Midlands County Combined Authority told this review that many young people experience the system not as a coherent journey but as disconnected interventions that stop and start at arbitrary thresholds. Careers England said that one of the national challenges in NEET prevention and reduction is the lack of coordination. There is no national framework, and multiple stakeholders have responsibility for different parts of the provision. Ealing Council told us that the current system is fragmented and failing. 577. What passes for coordination is mostly parallel play. Institutions work alongside each other. They do not work together. There is no unifying goal. There are many objectives that might overlap but are not collectively pursued. And critically, there is no accountability for the outcome as a whole. No authority to direct resources and efforts differently. Education is accountable for attainment, welfare for benefit flows, health for treatment. Nobody for the pathway from childhood to working life. 578. The pattern is clearest in crisis. When youth unemployment spikes, the state responds with emergency programs at scale. The New Deal for young people was set up in 1998 to tackle the legacy of the 1990s recession. The Young Person's Guarantee in 2009 after the financial crisis. Kickstart in 2020 following the COVID-19 pandemic. All have since been abolished. The Netherlands Youth Guarantee architecture has been permanent since 2014. When the crisis passes in Britain, the programmes are withdrawn. The institutional architecture that would sustain the response is never built. The country treats youth disengagement as a series of emergencies requiring temporary responses, when the evidence shows it is a permanent structural condition requiring permanent infrastructure. 7.2. National framework and local delivery, confused and becoming more complex. 579. The relationship between national policy and local delivery is unclear and becoming less clear. 580. In truth, there is no discernible national policy framework for dealing with the crisis in youth participation. Different Whitehall departments pursue their own strategies and develop their own plans. It is welcome, of course, that the DfE is focusing more on tackling educational inequality, that the Department for Work and Pensions is rolling out an enhanced youth guarantee, that the Department for Culture, Media and Sports has developed a youth strategy, and that the Department for Health and Social Care is testing new approaches for how the NHS can tackle economic inactivity. But there is little, if anything, that joins the dots. It does not feel like this has been a top priority for government, and nor is there a mission-based approach to dealing with the problem. This review provides an opportunity to put that right. 581. As I have described in Chapter 5, the NHS is a case in point. It does not see itself as part of the participation system, and yet it has a core role in dealing with the NEET crisis. It commissions its own services, sets its own priorities, measures its own activity, and reports to its own regulators. It does not routinely ask whether a young person is in education or work. It does not share data with schools, colleges or job centres as a matter of course. It does not treat participation as a clinical outcome. 3 pioneer integrated care boards, health and growth accelerators, are beginning to test accountability for work status. For the vast majority of the country, however, the health system remains a parallel universe, aware of the participation challenge in theory, structurally disconnected from it in practice. 582. Geographic misalignment compounds the problem. A young person in a single town may fall under one of 36 NHS integrated care boards, a different one of 19 combined or strategic authorities, one of 317 local authorities for housing and social care, and one of 37 job centre districts for welfare and employment support. Despite 4 overlapping maps, there is no single institution seeing the whole picture for that young person. 583. Mayors may have powers over adult skills, transport and economic development. They do not have powers over schools, welfare design, the benefit system or NHS commissioning boundaries. Adult skills funding sits separately from age 16 to 19 funding. Local authorities retain duties but frequently lack both the fiscal headroom and the authority over key institutions to drive a whole system response. 584. Local devolution has added actors without resolving the core problem of ownership. There is a strong case for local leadership to address the NEET crisis. Labour markets are local, transport is local, employer relationships are local. The barriers young people face are strongly shaped by place. But devolution has created partial responsibility without full control. Strategic authorities are bodies that have huge potential to enact change, and many have demonstrated this already. But, as new bodies, many also face severe capacity constraints and have limited delivery experience. They do not cover the whole country. Programs delivered at the hyperlocal level can also have a huge impact, such as those delivered through Sure Start centres and family hubs. For areas outside strategic authority boundaries, the question of who owns the local response remains unanswered. 585. Local government reorganisation is adding further uncertainty at the worst possible time. Boundary changes, the merger of district and county councils into new unitary authorities, and the redistribution of functions are happening simultaneously. For a system that already struggles with continuity, reorganisation is a further source of instability. 586. There is an unresolved constitutional question about who is responsible for what and where decision-making best rests between the local and the national. In the absence of clarity, confusion reigns. 7.3. No focus on outcomes and destinations. 587. The system has never organised itself around the outcome that matters, sustained participation in education, training or work. It is organised by age, not by sustained outcome. That is the design flaw from which much else follows. 588. Since 2015, there has been a legal requirement for young people in England to continue in education or training until 18. Local authorities have duties to track participation for 16 to 17-year-olds and to maintain systems to identify those not participating. Whatever its limitations, that framework creates clarity about who should act if a young person disengages. Nearly 9 in 10 16 to 17-year-olds were in education and training at the end of 2024. Note 564. Calendar year 2024. Participation in education, training and employment age 16 to 18. gov.uk. www.gov.uk. Published 26th of June 2025. Available at https://explore-education-statistics.service.gov.uk /find-statistics participation-in-education-and-training-and-employment/2024, and the text continues. The 16 to 18 NEET rate has remained below 5% since 2012. Note 565. Calendar year 2025. NEET age 16 to 24. gov.uk. www.gov.uk. Published 12th of March 2026. Updated 26th of March 2026. Available at https://explore-education-statistics.service.gov.uk/find-statistics/neet-statistics-annual-brief/2025, and the text continues. 589. But that coherence is abruptly time-limited. Beyond 18, there is no universal statutory duty on any institution to track, support and re-engage young adults simply because they are no longer participating. The system holds young people in while it owns the duty. It cannot carry them through once that duty falls away. In the Netherlands, by contrast, when it comes to 18 to 23-year-old students who do not have a basic qualification, schools are legally required to report unauthorised absences of 4 consecutive weeks of teaching or practical time to the municipality within 5 days. Note 566. Registering and reporting an unauthorised absence. Inspectorate of Education, Government of the Netherlands. www.onderwijsinspectie.nl. Available at https://onderwijsinspectie.nl/ongeopoliofd-verzuim. And the text continues. 590. Furthermore, the statutory requirements to track young people are applied inconsistently across England. Variation in funding, staffing, commissioning models, and local prioritisation has resulted in uneven data quality, often reflected in high numbers of young people reported with a status of not known, follow-up and outcomes between local authorities. 591. The incentive structure reinforces the problem. A school focuses on GCSE results, not on where the student ends up. It is recognised, regulated and rewarded for doing so. The same is true of a college. It focuses on recruitment, retention and completion within the funding window. The money it attracts is dependent on student numbers, retention and completion within that window, rather than sustained outcomes beyond it. Job Centre Plus administers claims and seeks to move those in the main work search regime into work. Health services manage appointments, thresholds and clinical risk. The NHS performance management system and the way finances flow through the system accentuates activity but not outcomes. 592. The welfare system compounds this. It was designed to replace lost income for adults who have been in work or for those who are unable to work. It is now the primary point of contact for young people who have never worked or who are moving into the labour market for the first time. It has not been redesigned for that purpose. It provides income. It does not build pathways. It measures incapacity. It does not plan for capability. 593. There is no pooled cross-system funding stream dedicated to preventing disengagement from age 18 to 24. There is no performance framework that holds any institution accountable for sustained participation outcomes across the whole age range. The current architecture is funded, measured and managed by programme and age band, not by end-to-end outcome. 594. This produces rational behaviour within institutions that is collectively irrational. Many councils, schools and colleges do a great deal to support post-age 18 destinations, despite significant funding pressures and system incoherence. But their overriding incentive is to ensure that young people are doing something, anything, until their 18th birthday, rather than in the longer term beyond it. Not a single part of the architecture, in health, education or welfare, is incentivized to prioritise good labour market participation outcomes for young people. 7.4. Funding has been cut and prevention has been deprioritised. 595. For much of the last 15 years, funding that could have helped prevent many young people becoming NEET has been cut. What remains rewards activity, not progression. 596. There is no specific funding stream for local authorities to discharge their participation duties. They must fund provision from their own central budgets or bid for pots from central government. Participation is therefore one of the many competing calls on often stretched local authority budgets, and one of the reasons why the quality of local NEET services varies enormously across England. 597. The Local Government Association told this review as part of their evidence submission that reductions to council budgets led to wider youth services expenditure falling by 73% in England between 2010-11 and 2023-24. Many youth clubs providing free after-school activities and access to youth workers have been closed. There were 34% fewer full-time equivalent youth workers in England in 2023-24 than in 2012-13. Note 567. Beyond the brink. The state of funding for youth services. YMCA. www.ymca.org.uk. Published January 2025. Available at https://ymca.org.uk/2025/01/YMCA-youth-services-beyond-the-brink.pdf. And the text continues. Analysis by the Institute for Fiscal Studies found a third of London's youth centres closed between 2010 and 2019, and children from lower socio-economic backgrounds who lost access to a nearby centre performed nearly 12% worse in exams at age 16. Note 568. Villa Carmen. The Effects of Youth Clubs on Education and Crime. Institute for Fiscal Studies. www.ifs.org.uk. Published 11th of November 2024. Available at https://sites/files/default/sites/2025-06/WP202451 the-effects-of-youth-clubs-on-education-and-crime.pdf. And the text continues. These services are not peripheral extras. They provide the relational infrastructure that helps prevent disengagement from becoming entrenched. 589. The impact is visible at local level. Kent County Council told this review that in 2018-19, their last major round of ESF funding, they had 42 training providers offering 1,451 places across the country. They now have 16 providers offering 720 places. That is not just a statistic. It is a lived reality in which an entire county's provision has halved. Warwickshire County Council told the review that there is a critical issue. the need for dedicated funding streams for 16 to 18-year-olds who do not qualify for 19-plus provision. Without this, local authorities will struggle to meet their statutory duty to ensure participation. 599. The funding that does exist is overwhelmingly short-term and programme-based. European Social Fund investment in employment, skills and social inclusion amounted to around £3 billion over the 2014 to 2020 period. Note 569. Summary. Impact evaluation of the European Social Fund 2014 to 2020. Programme in England, gov.uk, www.gov.uk. Published 14th of February 2025. Available at https://www.gov.uk/European-Social-Fund-2014-2020-Programme-in-England. And the text continues. Its successor, the UK Shared Prosperity Fund, UK SPF, which had a wider scope and ran for a shorter period, resulted in an average annual spend into people and skills of around £200 million across all age groups between 2022 and 2025. Total spend for 2022 to 2025 is £602 million, with the final year of UK SPF spend yet to be finalised. Note 570. UK Shared Prosperity Fund, UK SPF, Monitoring Returns, Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. That funding ended in April 2026. Local partners across the country describe short-term funding to the review as kryptonite for local systems. It prevents long-term planning. It destroys trusted relationships. Prevention has been cut at every level. Early years, public health, youth services, further education. What has grown is crisis spending, late intervention, hospital care, income replacement. The system spends more to achieve less, often paying for the consequences of problems it chose not to prevent. 7.5. No integrated services and no shared data. 600. I repeatedly heard and saw in the evidence I drew upon that, currently, services for young people do not integrate. Helpful data does not readily flow. That is the direct consequence of a system with no shared outcomes and funding that rewards activity over progression. 601. Current arrangements cannot therefore do the three things that matter most. See risk early, coordinate support coherently, and learn what works reliably. 602. Large volumes of information about young people are already held across education providers, local authorities, DWP, health services, and other parts of the state. The problem is that these fragments do not add up to a coherent picture. Narrow data sharing gateways exist for 16 to 18 participation duties, but are tightly restricted to basic identifiers. Wider welfare-related gateways exist, but are constrained, purpose-limited, and shaped by the possibility of criminal sanction for unauthorized disclosure. Even where sharing may be possible in principle, organizations default to caution because the boundaries feel narrow, risky, and difficult to navigate. 603. There are examples of good practice we can build on, including Skills Development Scotland 16+ Participation Portal. Note 571. Skills Development Scotland 16 Plus Participation Portal. Further information available at https://www.skillsdevelopmentscotland.co.uk//16plus-participation-portal. And the text continues. And the government's work with local partners in the Sheffield Community Mission Challenge. Note 572. Frontline workers and local communities to play crucial role in delivery of government missions. gov.uk. www.gov.uk. Further information available at https://frontline-workers-and-local-communities-2-play-crucial-role-in-delivery-of-government-missions. And the text continues. But these are currently exceptions in the wider UK context. 604. The consequences are cumulative. The framework does not allow risk to be seen early because visibility is fragmented and collapses after 18. It cannot tailor support because no single agency holds a sufficiently complete picture. The burden falls on the individual to repeat the same story to multiple services. For a young person with anxiety, low confidence and limited experience of institution, that burden is itself a barrier. What works is not consistently learned or applied because outcomes are not clearly defined or linked to interventions. 605. There is a further gap in the architecture that is rarely discussed. 84% of the variation in GCSE attainment in 2018 was explained by individual factors or factors outside the school gates, including demographic factors, e.g. eligibility for free school meals, parental background, parent-child relationship and the home learning environment. Note 573. The Home Learning Environment and Attainment, a research report, gov.uk, www.gov.uk, published August 2025. Available at https://assets.publishing.service.gov.uk/68B1B830D723BA6F4DBA81F /the_home_learning_environment_environment_attainment_research_report.pdf. And the text continues. And yet the system is designed entirely around institutions. It does not systematically connect with families. Where families are struggling, services alone rarely succeed. Where services are weak, families are left to cope alone. The system that treats the young person as an isolated unit moving between institutions without engaging with the family context or wider individual factors that shape 84% of the outcome has a structural blind spot at its centre. 7.6. Wild variations in local performance. 606. Without integrated services, shared data or outcome-based accountability, local performances vary widely. The quality of support a young person receives depends not on what they need, but on where they live. We want systems capable of responding to local community need. What we have is a system where local variation reflects capacity, not intention or design. 607. Even where duties exist, they are weekly monitored and enforced. The proportion of 16 to 17-year-olds who are NEET or not known ranges from 1% in Barnet to 21.5% in Dudley. Note 574. Academic year 24/25. Participation in education, training and NEET age 16 to 17 by local authority. gov.uk. www.gov.uk, published 17th of July 2025. Available at https://by-16-2-17-by-local-authority/2024-25. And the text continue. Local labour market conditions vary. The ability of local authorities to enforce the mandatory participation age should not. 608. The same variation is visible across every dimension. CAM's median waiting times range from over 100 days in some integrated care boards to 6 days in others. Note 575. Children's Mental Health Services 2023-2024. Children's Commissioner for England, www.childrenscommissioner.gov.uk, published May 2025. Available at https://www.childrenscommissioner.gov.uk/cco-childrens-mental-health-annual-briefing-may-2025.pdf. And the text continues. In 2021/22, the Children's Commissioner found that spending on children and young people's mental health per head varied from £34 to £141 between areas. Note 576. Children's Mental Health Services 2021-22. Children's Commissioner for England, www.childrenscommissioner.gov.uk, published March 2023. Available at https://assets.childrenscommissioner.gov.uk/2023/childrens-mental-health-services-2021-2022.pdf. And the text continues. Post-16 destination rates vary sharply by local authority. Youth service funding per head differs by an order of magnitude. This is not localised underperformance. It is systemic. The variation maps onto the geography of deprivation, local authority capacity, and the strength of local leadership. 609. Local flexibility matters, but to be most effective it must operate within a national framework that guarantees a minimum standard. Without that framework, devolution becomes delegation of failure. The post-18 cliff edge. Over 300,000 young people aged 18 to 24 lost in England alone. 610. The cumulative effect of these failures is felt most acutely at the post-18 cliff edge. 611. Perhaps the clearest sign that Britain does not have a functioning participation system is the scale of the hidden cohort. In 2023/24, around 314,000 18 to 24-year-old NEET people in England were not claiming benefits. As shown in Figure 37, this accounts for nearly half of NEET people in this age group. Note 577. Hidden NEETs in England. Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. This is the group who are hardest to reach and for whom we have little data. They are also the group growing fastest. Note 578. False starts. What the UK's growing NEET problem really looks like and how to fix it. Resolution Foundation, www.resolutionfoundation.org, published October 2025. Available at https://www.resolutionfoundation.org/app/uploads/2025/10/false-starts.pdf. And the text continues. They are not on any caseload. No institution is responsible for them. No service is reaching them. A system serious about preventing disengagement would know who its disengaged young people are, where they are, how long they have been outside learning and work, and which institution is responsible for supporting them. The current architecture cannot do any of that. Figure 37. NEET young people by benefit claimant status, England, 18 to 24-year-olds, 2023/24. Tiled grid showing the distribution of an estimated 677,000 NEETs across 6 benefit status categories. Nearly half, 314,000 or 46%, claim no benefits. Universal credit claimants comprise 313,000 individuals, 46%, split between those with no work requirements, 137,000 or 20%, those searching for work, 128,000 or 19%, and others, 48,000 or 7%. Smaller populations claim personal independent payment, 27,000 or 4%, or other benefits, 23,000 or 3%. Source: Rapid Longitudinal Educational Outcomes Labour Force Survey. Hidden NEET in England. Young People and Work Interim Report. Analytical Annex. And the text continues. 7.7. Government is seeking to address system-level issues. 612. It would be wrong to suggest that the government is unaware of these problems. The Youth Guarantee, Pathways to Work, Youth Trailblazers and accelerated expansion of youth hubs all represent serious attempts to address the structural gaps this chapter describes. Young Future Hubs are another intervention aiming to bring together services to better coordinate support for young people. 613. The Youth Guarantee Trailblazers are testing locally led approaches. West of England is targeting NEET young people with SEND and those in rural areas, including practical solutions like e-bike loans for transport-poor communities. Central London Forward is joining up services for care leavers, embedding referral pathways across leaving care teams, Job Centre Plus and new employment support teams, so that young people can find their key systems of support in a single location. 614. As previously noted, the 10-year health plan sets expectations for ICBs to establish measurable outcomes on economic inactivity and unemployment. 615. These are the right instincts. They demonstrate that when the system is given permission to join up, it can. But they are partial responses, not system redesign. The Youth Guarantee Trailblazers covers a small number of areas. Pathways to Work is not permanent architecture. The Pioneer ICBs are 3 out of 36. For the vast majority of the country, the health system has not set expectations about participation as a desirable outcome of clinical care. The question is whether these approaches will be sustained, scaled and embedded, or whether they will follow the pattern this review has documented across 2 decades. Build, evaluate, defund, forget. Northern Ireland, Labour Market Partnerships. The Department for Communities Labour Market Partnerships provide local solutions to meet local labour market needs. The aim of the labour market partnerships is to help improve employability outcomes and labour market conditions locally by working through coordinated, collaborative, multi-agency partnerships. This includes working with employers such as Henderson's, which has been delivering HGV training academies alongside the labour market partnerships. This approach helps to achieve regional objectives whilst being flexible to meet the needs presented by localised conditions and helping to connect employers with employees. Since inception in 2021, delivery has taken place across over 400 projects, with approximately 10,000 participants completing programs. Of those, over 50% have progressed into employment, self-employment or increased earnings, and approximately 60% have achieved a qualification, demonstrating both employment and skills outcomes. 7.8. Why the architecture matters. 616. In every part of the country I visited, I heard the same thing from different people. From employers, voluntary organisations, local government leaders, health bodies. 617. Britain has too many institutions with partial responsibility and too few with end-to-end accountability. The system is strongest where participation is compulsory, weakest where transition becomes voluntary, and least effective when young people's needs cut across institutional boundaries. 618. A system that loses clear responsibility at 18, tracks only part of the cohort, supports only a minority of those outside learning and work, and funds local capacity through fragmented and time-limited streams is not simply underperforming. It is helping temporary risk to calcify into long-term exclusion. 619. For young people with strong qualifications, stable health, family support and access to opportunity, the fragmentation can often be absorbed. For those with poor mental health, SEND, low attainment, caring responsibility, or for those who live in areas with weak local labour markets, it cannot. For them, the architecture is not a neutral backdrop, but represents a risk factor in its own right. 620. The absence of employer voice from the accountability framework is itself a structural gap. 93% of employers do not engage with DWP recruitment activities. Note 579. Summary: DWP Employer Survey 2024, gov.uk, www.gov.uk, published 16th of May 2025. Available at https://www.gov.uk/DWP-employer-survey-2024/summary-DWP-employer-survey-2024. And the text continues. No mechanism requires employers to co-invest in the transition from education to work. The countries with the lowest NEET rates actively enlist employers to be co-responsible for that transition. Britain treats them as passive recipients of whatever the education system produces. 621. In practice, risk is identified early. It widens the gap by 11. It loses track at 18. It certifies incapacity at 20. It administers detachment at 22. And at 24, it counts the result and calls it a statistic. When everyone has a role but no one is responsible, accountability for the pathway from childhood to working life is an orphan. 622. The conclusion is unavoidable. Britain has institutions for young people, but it does not yet have a coherent participation system. There is no coherent system, limited accountability, and no clear governance philosophy. What is required is not another short-term scheme layered on top of fragmentation, but structural reform around sustained participation through the whole transition from school to working life. This concludes Track 8. Track 9. This track is approximately 60 minutes long. Chapter 8. The consequences: lost lives, lost output, and rising fiscal risk. 623. The preceding chapters have set out the drivers of youth disengagement. This chapter sets out its consequences. 624. Those consequences are not confined to the young people immediately affected, serious though those are. They extend to families, employers, communities, public services and the taxpayer. They are personal, economic and fiscal, immediate, long-term and cumulative. What begins as a failure to support a young person at a critical stage of life can become a lasting loss of earnings, weaker growth, higher public spending and greater pressure on the next generation. This is not a temporary or self-correcting problem. As the number of young people who are NEET rises and the drivers of disengagement become more entrenched, so too do the costs. The question is no longer simply how many young people are being left behind, but what that failure is costing the country. 8.1. Where we are heading. 625. There is a view, presented as worldly pragmatism, that current NEET rates are unremarkable and will inevitably recede. The UK has long had relatively high rates of youth unemployment and persistent economic inactivity, but that logic is flawed. 626. In earlier decades, a much larger share of youth inactivity was accounted for by young women looking after their children. That number has fallen significantly in England, from over 240,000 people in the early 2000s to less than 100,000 in recent years. Note 580. Annual estimates from the Labour Force Survey of young people aged 16 to 24, not in education, employment or training, NEET, in England, 12th of March 2026. Looking after family and home as proxy. Available at https://explore-statistics.service.gov.uk/find-statistics /neat-statistics-annual-brief /2025 section-trends-in-neat-rates-by-age. And the text continues. This should strike a note of optimism that participation patterns can change when policy and wider social conditions expand women's choices and make returning to work or education more feasible after motherhood. Today, the picture is different. Ill health and disability have become much more central to youth detachment, affecting young people of both sexes. We have no comparably clear path to change. 627. We cannot be precise in forecasting how the number of 16 to 24-year-olds out of work will evolve in the face of demographic, macroeconomic and societal trends and the way in which these interact. What we do know is that the prevalence of most of the key NEET risk factors has increased since around 2017-18, when today's 24-year-olds were 16. 628. The number of young people with a disability, mental health issues, and school suspensions and exclusions have all grown by more than 75% without clarity on where they will stabilise. Because the youth population has grown in recent years, the number of 16-year-olds not achieving Level 2 qualifications at Key Stage 4, the single largest contributor to NEET risk, has risen despite percentage improvements in GCSE attainment. Note 581. GCSE outcomes in England. Ofqual. Analytics.ofqual.gov.uk. Published 2025. Available at https://analytics.ofqual.gov.uk/apps/GCSE/outcomes/. And the text continues. Persistent and severe absence in state-funded secondary schools in England has more than doubled since 2018 from 445,000 pupil enrolments to more than 912,000 in 2025. Note 582. Department for Education. Absence rates by geographic level for special state-funded primary and state-funded secondary in England between 2017-18 and 2024-25. Published 14th of May 2026. Available at https:// explore-education-statistics.service.gov.uk/4/data-tables/18A403C16-9/4A30D0EF-08D-0E/DE0E/3771. And the text continues. 629. Concerningly, where improvements have been made in areas such as early parenthood, these are generally in factors impacting a comparatively small proportion of the population. 630. This is compounded for future years by ongoing growth in the population, or demographic bulge of young people. There were an estimated 846,000 16-year-olds in the UK in 2024, an increase of 135,000 since 2018, and more than 600,000 additional teenagers aged 11 to 16, 5.1 million total in 2024. Note 583. Population estimates for England and Wales, mid-2024, ONS, www.ons.gov.uk, published 30th of July 2025. Available at https://www.ons.gov.uk/people, population and community /population and migration /population estimates /bulletins /population estimates for England and Wales /mid-2024. And the text continues. Critically, the young people who should now be entering the labour market are the COVID-19 generation. 631. Of course, as set out in Chapter 1, there are many individual and contextual determinants whether someone becomes NEET, and for how long. But taking the cumulative impact of the growth in risk factors indicates that up to 500,000 more young people are at risk of becoming NEET in the next 5 years if prevalence stabilises at its observed level, rising to 800,000 more if it continues to grow at its current rate. Not all of these young people will become NEET at once, but this will manifest in a persistently higher annual NEET rate. 632. This does not take account of the deteriorating macroeconomic and labour market context that young people are facing, described in Chapter 3. 633. So what does all of this add up to? Even if the NEET rate fell to the historical lows of 10% by 2031, this would mean 780,000 young people NEET. In actual fact, the proportion of NEET young people has been steadily rising since the pandemic. Forecasting conducted for this report suggests the NEET rate will remain unacceptably high and will exceed 1 million within the next 2 to 3 years. That is a conservative estimate as it is based on the current trend line, which does not take account of likely deteriorations in young people's health, rises in other NEET risk factors, and further labour market changes. Accounting for the risk factor increase described above, the NEET rate could increase to over 16% or more than 1.25 million young people not fully participating in society within 5 years. Table 1. Scenarios for NEET rates 2031. Scenario. Macroeconomic trends. Description. Baseline rate based on historical trends and macroeconomic forecasts, adjusted for the demographic bulge of young people entering the labour market. Rate in 2031, 12.9%. Number in 2031, 1,010,000. Scenario. Stabilising risk trends. Description. The prevalence of risk factors stabilises at its current observed level and translates into more young people becoming economically inactive or long-term unemployed. Rate in 2031, 14.9%. Number in 2031, 1,160,000. Scenario. Increasing risk trends. Description. Risk prevalence continues to grow, and this translates into more young people becoming economically inactive or long-term unemployed. Rate in 2031, 16.3%. Number in 2031, 1,270,000. Source: Young People and Work Interim Report, Analytical Annex. Note: the increasing risk trends estimate corresponds to the 500,000 to 800,000 estimate provided. This represents the total number of young people who could ever become NEET, which is larger than the number who are NEET at any given point of time due to inflows and offlows. And the text continues. 634. In every scenario, the number of young people NEET is unacceptable. On virtually every indicator, the trend lines are deteriorating. They are not short-term pressures that will fade on their own, but the consequences of a deeper and worsening problem. Rising NEET levels matter not only because they reflect growing disengagement, but because each young person shut out of work or education represents a loss to themselves, a strain on their family, and a growing cost to the wider economy and state. 8.2. Lives on hold. The cost of early detachment. 635. Behind every number in this chapter is a young person whose life is being diminished. The first and most important consequences are borne by young people themselves. When early adulthood is dominated by inactivity, repeated rejection, or poorly managed health conditions, the damage is wide-reaching. 636. The most direct consequence is on an individual's income. In the absence of steady work, young people rely on family networks, benefits, and informal work. At a time when young people are spending more on essentials than ever before, this has real consequences. Recent research by Trussell has found a 59% increase in the number of food parcels provided to 17 to 24-year-olds between 2019-20 and 2024-25, and a 62% increase for 12 to 16-year-olds. Note 584. Hunger in the UK, Trussell Trust, trussell.org.uk, published September 2025. Available at https://the/UK/2025-1//hunger_in_the_261125.pdf. And the text continues. The debt charity Step Change found that the most common reason for debt among its customers aged 18 to 24 was unemployment and work-related instability, cited by 1 in 5 compared to 1 in 7 across its entire customer base. Note 585. Debt's early grip. The challenges facing young adults. Step Change Debt Charity. stepchange.org. Published November 2024. Available at https://www.stepchange.org/portals/0/23/reports/debts percentage to 0 early percentage to 0 grip /client insights debts early grip November 2024 final.pdf. And the text continues. In some cases, costs themselves become a barrier to employment, particularly transport. 637. This also has an impact on families and parents. The proportion of young people living at home today is much higher than in the past. Analysis of the most recent Millennium Cohort study found 7 in 10 of the 23-year-old respondents lived at home with their parents, with the most common reason provided being that they could not afford to move out. Note 586. Centre for Longitudinal Studies, Early Family Transitions. Initial findings from the Millennium Cohort study at age 23. February 2026. Available at https://from-the-millennium-cohort-study-at-age-23.pdf. And the text continues. As well as potential financial strain, research has found that this can be emotionally difficult for parents, with worse impacts when unemployed and low-income children return home. Note 587. Tossi Marco. Boomerang Kids and Parents' Well-Being. Adaptation, Stressors and Social Norms. ISER. www.iser.essex.ac.uk. Published 15th of June 2020. Available at https://www.iser.essex.ac.uk/publication-525984. And the text continues. This compounds inequality, given both the socio-economic factors associated with NEET status and that being NEET increases the likelihood of not being able to afford to live independently. The consequences of both being out of work and the lower associated income can further impact well-being, physical health and mental health. These are good examples of the two-way relationship between disadvantage and disengagement. Some young people become NEET because they are already struggling with their health or well-being, but prolonged time out of work or education can also make those problems worse through isolation, insecurity, repeated setbacks and lack of routine or support. Using subjective well-being responses to the annual population survey and the HMT Wellbeing Guide for Appraisal allows for monetization of this impact at approximately £2,900 per young person per year. Note 588. Wellbeing Guidance for Appraisal, Supplementary Green Book Guidance, gov.uk, www.gov.uk, published July 2021. Available at https://wellbeing_green_book_guidance.pdf. And the text continues. Scarring, the damage that does not heal. 638. Research has shown that the experience of being NEET is associated with poor physical and mental health outcomes, and prescriptions for anxiety and depression are 50% higher in the 10 to 20 years following their period out of education or training. Note 589. Feng Z, Ralston K, Everington D, Dibben C, 2017. Long-term health effects of NEET experiences. Evidence from a longitudinal analysis of young people in Scotland. International Journal of Population Data Sciences. IJDPS.org. Published April 2017. Available at https://ijpds.org/article/view/327. And the text continues. This work also found cumulative effects over time, with even greater disadvantage for those who remained NEET for longer. 639. Studies have shown that labour market scarring, spells of unemployment or inactivity early in life, reduces lifetime earnings and increases the likelihood of future worklessness. De Fraga, Lemos and Rocky, 2021, calculate that each month of unemployment at age 18 to 20 leads to a permanent income loss of 1.2% per month unemployed, with a reduced impact of 0.35% if the unemployment occurs at age 21 to 23. Note 590. Gianni de Freya, Sarah Lemos, James Rocky, The Wounds That Do Not Heal. The Lifetime Scar of Youth Unemployment. Economica, published August 2021. Available at https://ideas.repc.org/p/bri/CMPOWP/04-09.html. And the text continues. No significant impact is found for unemployment at older ages. Gregg and Tomini, 2005, find that unemployment at age 23 leads to earning scars of 8 to 10% at age 42, with higher rates of 12 to 15% for those who had repeat incidences. Note 591. Paul Gregg and Emma Tomini, The Wage Scar from Youth Unemployment. The Centre for Market and Public Organisation, University of Bristol, bristol.ac.uk. Available at https://ideas.repc.org/p/bri/CMPOWP/04-097.html. And the text continues. 640. These studies allow us to estimate the working lifetime earnings impact of a period spent neat up to age 68, when the young person of today will be eligible for their state pension. This is the difference between what an individual could have earned if they had never experienced a period out of work or education in their youth against the expected scarring impact on their employment outcomes. 641. Table 2 presents estimates of the impact over a working lifetime of time spent neat as an 18 to 24-year-old. The ceiling estimate refers to those young people who are out of work for the entire 6-year period, but subsequently enter employment. Close to half of all neat young people have been out of work or education for more than a year. Note 592. Learning and Work Institute. Young people who are not in education, employment or training. What does the data tell us? Published April 2025. Available at https://lw.org.uk/neat_data_April 2025-3.pdf. And the text continues. While the number of young people who are neat for 5 or more years are a minority, it is not an insignificant one. 28% of 24-year-old neat people have been out of full-time education since they were 18, have not had a paid job in at least 5 years, or have never had a paid job. Note 593. Duration since last job or full-time education for those not in education, employment or training. Young People and Work Interim Report, Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. 45% have never had a paid job. Note 594. Young people who are not in education, employment or training. What does the data tell us? Learning and Work Institute. learningandwork.org.uk. Published April 2025. Available at https://learningandwork.org.uk/wp-content/uploads LW_neat_April 2025-3.pdf. And the text continues. For these young people, inactivity is not a brief interruption between education and work. It is the beginning of prolonged detachment that often extends beyond their 25th birthday, with postponed independence and without the experience of work that is essential for building prospects, long-term financial security and resilience. Table 2. Individual working lifetime earnings lost due to a period NEAT between 18 and 24. Estimate. Per year NEAT. Average lifetime earnings loss, net, £52,000. Estimate. Ceiling estimate NEAT aged 18 to 24. Average lifetime earnings loss, net, £293,000. Source. Young People and Work Interim Report. Analytical Annex. Note. Ceiling estimates should not be interpreted as annual figures. Earnings are presented as net of income taxes, national insurance and benefits. Full details of calculations set out in the technical annex. And the text continues. 642. It is not possible to fully capture the complexities of a life, but these figures give an indication of the vast personal cost of inaction. 8.3. The direct economic cost, output foregone. 643. When large numbers of young people are unable to build skills, earn and enter stable work, those lost opportunities add up to lost output at a national level. What begins as individual detachment becomes at scale a drag on growth, productivity and living standards. The immediate economic consequence of failing to support young people into employment can be expressed in straightforward terms. If every currently NEAT 18 to 24-year-old had been in full-time work in the last year, this would have contributed an additional £38 billion to UK gross domestic product. 644. When the annual scarring impact is aggregated across those young NEAT people most likely to experience scarring impacts, who have been NEAT 6 months or more, the total loss rises to over £100 billion. That is very close to the entire size of the UK arts and hospitality sectors combined. Note 595. Nominal and real regional gross value added, balanced by industry. Office for National Statistics, 2023. Published 17th of April 2025. Available at https://www.ons.gov.uk/economy/gross value added GVA/datasets/nominal and real regional gross value added balance by industry. Accommodation and food services activities and arts, £70 billion. Entertainment and recreation, £34 billion. 2023 values. And the text continues. The scarring estimates represent a permanently lower level of GDP, potentially lost not only for the individuals but also the wider economy. Table 3. Total output potential loss due to 18 to 24-year-olds NEAT. Estimate. Estimated direct impact on output. Total economic impact, I. Net present value, £38 billion. Estimate. Estimated scarring impact on output. Total economic impact, I. Net present value, £63 billion. Source. Young People and Work Interim Report. Analytical Annex. Note. Scarring estimate aggregated across proportion of population most likely to experience scarring penalty. NEAT for 6+ months. Scarring impact presented as net present value. And the text continues. 645. Reduced economic growth limits our country's ability to improve living standards over time through wages and employment opportunities. It undermines business confidence, which reduces investment and the potential for innovation. At a more local level, There is a negative feedback loop. Fewer young people in work means that they have less income to spend on local businesses, whether that be retailers, hospitality or the gym. Communities need their young people to thrive. Every year the system fails to act, the bill grows. 8.4. Fiscal exposure, a cost dispersed across the state. 646. The true fiscal cost of youth disengagement is easy to miss because it does not sit with just one part of government. It is spread across benefits, lower tax receipts, health spending, housing support, local services and, in some cases, the justice system. That matters because no single department sees the full picture, and no single department is forced to carry the full consequences of failure. But the costs are real nonetheless, and they accumulate across the state. 647. In practice, this fiscal exposure works through three main channels: tax revenue foregone, direct benefit spending and wider public service costs linked to poorer health, insecurity and prolonged worklessness. In what follows we seek to estimate the true cost to the public purse of the NEAT phenomenon. Lost tax revenues. 648. The most direct and universal fiscal consequence is foregone tax revenue. While the 314,000 hidden young NEAT do not pose a direct cost to the state because they do not claim benefits, their disengagement nevertheless has a fiscal consequence. Across all NEAT young people, the annual lost output implies a substantial level of tax revenue foregone. £3.2 billion in income tax receipts and national insurance contributions in the current year, without considering employer contributions or wider consumption-linked taxes. When young people face lower employment and earnings due to the scarring impact, this has knock-on implications for the state. Table 4. Foregone tax revenue, income tax and national insurance contributions from 18 to 24-year-olds NEAT. Estimate. Estimated direct foregone revenue per person £3,800. Total revenue foregone £3.2 billion. Estimate. Estimated scarring foregone revenue per person £15,000. Total revenue foregone £10.8 billion. Source. Young People and Work Interim Report. Analytical Annex. Note, scarring estimate aggregated across proportion of population most likely to experience scarring penalty. NEAT for 6+ months. Scarring impact presented as net present value. And the text continues. 649. As the UK faces challenges in the long term due to factors such as an ageing population and the fiscal consequences, permanently lower employment and earnings rates put even greater pressure on the old age dependency ratio needed to maintain growing state pension, healthcare and welfare costs. Benefit spend. 650. When benefit spending is included, the numbers become higher still. Low participation is a double-edged sword. Not only does it lower tax receipts, it also increases benefit spending. Of the estimated £8.1 billion spent on young people across key benefits, approximately £4.4 billion goes to NEAT young people. Some of these benefits, such as PIP, are independent of employment or education status, but we estimate that a total of £3.2 billion could have been avoided if NEAT young people had been in work and earning above earnings thresholds. These numbers are concerning in their own right, but as discussed in Chapter 6, the story of the limited support that underpins them is even more alarming. 651. Despite the substantial number of young people not claiming benefits, long-term scarring impacts will increase the long-term cost to the exchequer for each additional month a young person is out of work. Health and broader public spending costs. 652. Reduced tax revenues and higher benefit payments only tell part of the story. Health and social impacts are more difficult to track and quantify, but no less real. 653. The Centre for Mental Health has estimated that the government cost of all ill health in England is £25 billion across NHS community and hospital health services, tax revenue, GP expenditure, social services and medication. Note 596. The economic and social costs of mental ill health. Centre for Mental Health. www.centreformentalhealth.org.uk. Published March 2024. Available at https://wp-content/uploads/2024/03/Centre for MH_ the economic social costs of mental ill health -1.pdf. And the text continues. To indicate scale, that is equivalent to more than £850 million a year for the 60% of young neat people with a likely mental health condition. Note 597. Health equals a vicious cycle. Young people out of education, employment or training, March 2026. Available at https://health-equals.org.uk/not-earning-or-learning/ And the text continues. The bidirectional relationship between unemployment or economic inactivity and mental health means that the public cost is not simply the cost of poor mental health among young people who happen to be neat. Unemployment has been shown to negatively impact mental health outcomes. Note 598. Thompson, Rachel M. et al. To what extent does income explain the effect of unemployment on mental health? Mediation Analysis in the UK Household Longitudinal Study, published 2022. Available at https://pubmed.ncbi.nlm.nih.gov/36453184/. And the text continues. For some people, being neat itself is likely to intensify need and increase the demand placed on services. 654. In 2023, the Office for Budget Responsibility estimated that there was £910 additional per person cost to the NHS when people with a health condition are economically inactive compared to if they had been active. Note 599. Fiscal Risks and Sustainability, July 2023. Office for Budget Responsibility, OBR.UK. Published July 2023. Available at https://obr.uk/fiscal-risks-and-sustainability-July-2023. And the text continues. In 2025 prices, that is a cost of approximately £200 million across the 200,000 young people inactive due to sickness, and an increase of approximately £67 million from before the pandemic, when there were 70,000 fewer out of work for this reason. 655. For individuals already at the greatest disadvantage, the intersection of financial challenges with family, personal and health circumstances can deteriorate outcomes even further. Centrepoint estimates over 120,000 young people were homeless or at risk of homelessness in the UK in 2025, a 6% increase on the previous year. Note 600. University of Manchester. Young people in the UK's poorest households 3 times more likely to be neat. Available at https://www.manchester.ac.uk/news/young-people-in-UKS-poorest-households-3-times-more-likely-2- b-neat / see technical annex for details. And the text continues. Although some young people experiencing homelessness will be employed or in education, the instability of worklessness is a significant risk. In 2023, Centrepoint estimated that the government cost of youth homelessness was £2.5 billion across criminal justice, homelessness services, social security and various health services, as part of a wider cost of £8.5 billion in economic and social terms. Note 601. Human costs and loss potential. The real cost of youth homelessness. Centrepoint, www.centrepoint.org.uk. Published 2023. Available at https://centrepoint.org.uk/sites/default/files/2023-09 /cost percentage 20 of percentage 20 youth percentage 20 homelessness percentage 20 research percentage 20 report percentage 20 percentage 20 full percentage 20 report percentage 202023.pdf. And the text continues. These are not peripheral costs. They show how youth disengagement increases demand across multiple services at once, raising pressures on homelessness support, the justice system, social security and health. 656. The link between young people NEET and crime is complex. Research has found that young people living in high crime areas are more likely to be NEET. Note 602. Carida Magdaleni. The influence of neighbourhood crime on young people becoming not in education, employment or training. Published 13th of January 2020. Available at https://10.1080//01425692.2019.170706 And the text continues, and that NEET young people are more than twice as likely to engage in criminal behaviour compared to those who are not NEET. Note 603. Rahmani, Hamed, Groot, Wim and Rahmani. Amir Mohammed. Unravelling the NEET Phenomenon. A systematic literature review and meta-analysis of risk factors for youth not in education, employment or training. Published 24th of March 2024. Available at https://10.1080/02673843.2024.233156. And the text continues. A recent report by Policy Exchange estimates that crime costs the UK £170 billion a year. Note 604. The costs of crime and how to reduce them. Published 2025. Available at https://policyexchange.org.uk/wp-content/cost-of-crime-percentage E2%-80%-93-and-how-to-reduce-them.pdf. And the text continues. Whether cause or consequence, it is clear that the sum of getting young people engaged in society, whether through employment or education, is greater than the sum of its parts. 657. The figures in Table 5 represent the average lifetime public finance impacts of each young person NEET. These figures include foregone income tax and national insurance contributions due to lower earnings and additional benefit spend where individuals are out of work. The challenge of untangling the relationships between early disadvantage, NEET status, and the wider social challenges this can bring about means that it is difficult to establish a robust estimate that fairly represents the majority of young people. These costs have been conservatively excluded from the costs set out below. Table 5. Lifetime public finance impact of a period NEET 18 to 24. Estimate. Per year NEET. Average lifetime cost to the state. J. Net present value. £29,000. Estimate. Ceiling estimate. NEET aged 18 to 24. Average lifetime cost to the state. J. Net present value. £240,000. Source. Young People and Work Interim Report. Analytical Annex. Note. Ceiling estimates should not be interpreted as annual impacts. Figures include income tax and national insurance contributions foregone and additional benefits spent. And the text continues. 658. The ceiling estimate assumes that the state will support individuals through universal credit and with housing costs when they are out of work. For many, the costs may be higher still. Where government chooses to spend money. The Keep Britain Working Review found that a young person who never works will forego over £1 million in earnings over their lifetime. Supporting someone on the current universal credit standard allowance and housing levels alone would cost the government close to £500,000 over the same time period, and potentially much more if factors such as incapacity factored in. K. Assumes no significant change to benefit regime. Undiscounted value. Note, individuals may receive universal credit while in work dependent on earnings. And the text continues. Late intervention. There is evidence that, as a country, we have chosen to spend more money on paying for the cost of young people becoming NEET than of preventing that from happening in the first place. Figure 38 shows which priorities have been chosen, in this case by local authorities, when net expenditure on late intervention services has increased by nearly £4 billion in real terms since 2014/2015, while early intervention has fallen. In the last 15 years, support has become thinner, less coherent and less well funded. Many of the institutions that act as protective factors for young people have faced cuts. Work by the YMCA has found that local authority spending on youth services has real terms fallen by 76% since 2010/11. Note 605. Local authority funding for youth services sees biggest annual cut in almost a decade. New YMCA analysis reveals. YMCA. ymca.org.uk. Published February 2026. Available at https://ymca.org.uk//new-services-sees-biggest-annual-cut-in-almost-a-analysis-reveals and the text continues. This pattern begins to play out at the earliest stage and across the different settings in a young person's life. Figure 38. Early versus late intervention service spending by local government 2015/16 to 2024/25. Stacked area chart financial years 2015/16 to 2024/25, showing expenditure on early versus late intervention stacking to totals approximately £11 to £14.6 billion. Early intervention, green, remains relatively flat, £2.2 to £2.5 billion throughout. Late intervention, dark blue, shows growth from £8.1 billion 2015/16 to £12.0 billion 2024/25. Total rises from £11.0 billion to £14.6 billion over decade. X-axis financial years 2015/16 to 2024/25. Source: Department for Education LA and School Expenditure. Young People and Work Analysis. Methodology adopted from Pro Bono Economics and NSPCC Children's Services Spending Report Series. Note 606. NSPCC Learning Children's Services Spending Reports. Available at https://learning.nspcc.org.uk/research-resources/children's-services-spending-reports. Source continued. Early intervention spending is defined as Sure Start children's centres and other spending on children under 5. Total family support services and total services for young people. Late intervention funding is defined as youth justice, total children looked after and total safeguarding children and young people services. And the text continues. Spending on children and young people has shifted over time, with protective factors such as family support services and youth services declining. Youth justice and spending on children looked after has only increased. The limited focus on prevention flows down into education and employment outcomes. Crisis spending on late intervention, health costs and income replacement increases. The funding cliff. The pattern of public spending shows a sharp drop-off in support at the point many young people need it most. While young people remain in school, college or university, the state is willing to invest substantial amounts in them, even if that amount has decreased over time. Note 607. Annual Report on Education Spending in England 2025/26. IFS. www.ifs.org.uk. Published 21st of January 2026. Available at https://publications/annual-report-education-spending-england-2025-26. And the text continues. But once they fall out of education without a secure route into work, support becomes far thinner and less coherent. Table 6. Estimated spend per individual across different life stages, England 2024/2025. Stage, early years, spend £5,500, unit per child, age 0 to 5. Stage, primary school, spend £7,000, unit per pupil, age 4 to 11. Stage, secondary school, spend £7,800, unit per pupil, age 11 to 16. Stage, further education, spend £7,900, unit per student, age 16 to 18. Stage, higher education, spend £9,900, unit per student, age 18 to 24. Stage, employment programs and JCP, spend £2,000, unit per participant, age 18 to 24. Stage, out of work benefits, spend £5,000, unit per claimant, age 18 to 24. Source, Annual Report on Education Spending in England 2025-26. Institute for Fiscal Studies. Young People's Work and Interim Report. Analytical Annex. And the text continues. At precisely the point where tailored employment support could make the biggest difference, the system too often defaults to minimal intervention and later income replacement through the benefit system. Early intervention does pay off for young people. Why is support so limited? The decision to prioritise income replacement over active labour market support can seem rational for older groups and in a constrained fiscal environment. The key concerns for the Exchequer about active labour market programmes are the concepts of deadweight loss and displacement. It will rightly want to avoid in as far as possible spending money on those who would have found a job without state support, or of someone backed with state support taking a job opportunity that could have gone to someone else. These criteria are how the Exchequer goes about making value for money assessments of employment programs. When those criteria are applied, the conclusion it often reaches is that the fiscal benefit of the spend is only just expected to cover the state's costs. But the equation has to be different for young people. Although the likelihood that they will return to the workplace without intervention may be higher, young people also carry significant consequences for time out of the workplace not seen in older age groups. Conventional value for money assessments consider the average person and do not look over a long enough time frame to fully capture lifetime costs. When the scarring impact of time out of employment among young people is taken into account, the fiscal argument and arithmetic fundamentally shifts. When it comes to young people, early intervention pays for itself many times over. The consequences. 659. The scale of youth inactivity is not simply a social concern. It is an economic one, a fiscal one, and a generational one. 660. Each year that a large share of young adults remain outside learning or work, the economy foregoes tens of billions of pounds in output. Each year of delayed participation compounds the long-term earnings penalty and increases the likelihood of future dependency. Benefit caseloads grow and expenditure rises. Health costs accumulate. The tax base narrows. This is not a neutral steady state, it is a ratchet. Table 7. Summary costs of young people NEET. Category, economic. Element, direct economic potential lost. Total annual cost, £38 billion. Category, economic. Element, scarring economic potential lost. Total annual cost, £63 billion. Category, public finance. Element, direct tax revenue lost. Total annual cost, £3.2 billion. Category, public finance. Element, increased health spending. Total annual cost, £0.2 billion. Category, public finance. Element, direct benefit spend on out-of-work benefits. Total annual cost, £3.2 billion. Category, public finance. Element, scarring tax revenue and benefit spend. Total annual cost, £15 billion. Category, social. Element, direct well-being impacts. Total annual cost, £2.7 billion. Total annual cost, £125 billion. Source, Young People and Work Interim Report, Analytical Annex. Note, yearly scarring estimate used, with impact only included for proportion of young people who have been NEET 6 months or more. Note, elements such as tax revenue and benefit spend are considered transfers and will net out at the societal level. And the text continues. 661. Table 7 above estimates the cumulative cost to our country of almost 1 million NEET young people at £125 billion a year. This is more than we spend on education every year in England. Note 608. Annual Report on Education Spending in England 2025/26. IFS. www.ifs.org.uk. Published 21st of January 2026. Available at https://ifs.org.uk/publications/annual-report-education-spending-england-2025-26. And the text continues. The question is no longer whether the current position is affordable. It is whether it is sustainable. 662. Ultimately, of course, the case for change is neither a purely economic or financial argument. There is an ethical duty to enable every young person to have the opportunity to fulfill their potential, regardless of their socio-economic background or health status. But we also cannot ignore the implications on the economy or our public finances in the context of an ever-stretched state. It is rare to find a policy area where change could improve people's lives, strengthen public finances, and foster economic growth. Getting young people back into work or education has the potential to achieve all three. This concludes Track 9. Track 10. This track is approximately 15 minutes long. Chapter 9. The Fork in the Road. 663. Across this review, the evidence has been examined from every angle. The scale of youth inactivity, who is affected, how the NEET population has changed, how young people feel about their lives, where risk accumulates, what the labour market no longer provides, what faultiness exists in the system that is supposed to ease young people from the world of education into the world of work, what all of this costs, and where current trends lead if nothing changes. 664. There is a lot of data, much analysis, many words, but it all boils down to this core conclusion. We have a deeply entrenched problem that is getting worse and a system that has been trying but failing to deal with it. Fundamental and far-reaching reform is needed. The country has reached a point where inaction or iterative tinkering is itself a decision and a costly one. 665. Britain is no longer facing a marginal youth employment problem. It is confronting a systemic failure at the point where a generation is supposed to transition into adulthood. This is not a temporary shock. It is not a post-pandemic hangover. It is not a question of motivation or culture. It is a structural breakdown with profound consequences for economic performance, fiscal sustainability, and social cohesion. 9.1. This is not a record of passivity. It is a record of failure. 666. Britain has not ignored youth unemployment. For more than 2 decades, governments have intervened repeatedly and at scale. New Deal for young people, the Future Jobs Fund, the Work Programme, the Youth Contract, Traineeships, Kickstart, the Youth Offer. This is not a record of passivity. It is a record of sustained policy effort. Sadly, it is also a record of failure. 667. Despite these interventions, the structural 16 to 24 NEET rate has not been durably reduced. It has barely fallen below 10% in 25 years. Note 609. Young people not in education, employment or training. NEET. Office for National Statistics. www.ons.gov.uk. Published 26th of February 2026. Available at https://www.ons.gov.uk/employment and labour market /people not in work /unemployment /datasets /young people not in education, employment or training, NEET, Table 1. And the text continues. The composition of the cohort has shifted towards economic inactivity. Note 610. Trends in young people not in education, employment or training. January to March 2025. Youth Futures Foundation. youthfuturesfoundation.org. Published May 2025. Available at https://youthfuturesfoundation.org /wp-content /uploads /2025/06 /neets-trends-analysis-q2-2025.pdf. And the text continues. Our NEET rate has deteriorated in comparison with other nations and is now above average for high-income countries. Note 611. Youth not in employment, education or training, NEET indicator, OECD, www.oecd.org/en.html, published 2026. Available at https:// www.oecd.org/en/forward/data/in-employment-education-or-training-neat.html. And the text continues. That should trouble anyone who believes the current approach is working. 668. The question is therefore not whether programs have had some impact. Many have made a difference. The question is whether they have altered the fundamental fault lines that produce sustained disengagement. The evidence suggests they have not. 669. Here we must be honest. There are significant gaps in the evidence base about interventions that might work, particularly for the cohort that now dominates. Young people with mental health conditions and neurodevelopmental needs. 670. One thing is for certain, new approaches are needed. This cannot be tagging on to the existing system a few new initiatives. 671. Public policy in the UK traditionally operates in cycles. A new intervention responds to rising unemployment or political urgency. It is funded for a defined period. It generates credible impact. Funding ends. Institutional memory dissipates. Responsibility returns to fragmented departments. The capacity is lost. Young people pay the price. It is, as one expert advisor to this review put it, completely mad that once a decade the state goes about building from scratch a new program, with all the associated fixed costs of setup, capacity building, employer engagement, and data and accountability, only to let it expire and start again. 672. The structural nature of the NEET challenge today calls for something more profound. It is a system reset that is needed. 673. Our final report, which will be published later this year, will set out what this needs to look like. 674. The cost of failing to act is not abstract. As set out in Chapter 8, failure to address high NEET rates is costing us £125 billion a year. PIP expenditure for 16 to 24-year-olds has risen from £1.3 billion to £3.2 billion in 5 years. The gateway, once entered, becomes a one-way valve. The system is growing. Its purpose is not changing. It pays for the problem. It does not solve it. 675. The pipeline of risk is not shrinking. It is growing. Almost a quarter of children aged 11 to 16 had a probable mental health disorder in 2023, up from almost 1 in 7 in 2017. Note 612. Mental health of children and young people in England 2023. Wave 4 follow-up to the 2017 survey. Data tables. NHS England. www.england.nhs.uk. Published 21st of November 2023. Available at https://wave-4-up/data-sets. And the text continues. In 2024/25, nearly 1 in 5 pupils were persistently absent. Note 613. Pupil absence in schools in England. gov.uk. www.gov.uk. Published 26th of March 2026. Available at https://explore-education-statistics.service.gov.uk/find-statistics/pupil-absence-in-schools-in-England/2025. And the text continues. Almost 1 in 7 receive special education needs support. Note 614. Special Educational Needs in England, gov.uk, www.gov.uk, published 12th of June 2025. Available at https://explore-education-statistics.service.gov.uk/special-educational-needs-in-england/2024-25. And the text continues. Almost 1 in 6 children aged 10 to 14 are classified as disabled, up from 1 in 10 from 2019/20. Note 615. Family Resources Survey, Financial Year 2024 to 2025. Disability Data Tables, gov.uk, www.gov.uk, published 26th of March 2026. Available at https://govt.uk/family-resources-survey-financial-year-2024-2-2025. And the text continues. Learning difficulties and autism are growing significantly faster than mental health conditions as the primary health conditions among NEET young people. Note 616. NEET, Primary Health Conditions, Estimates from the APS, gov.uk, www.gov.uk, published March 2026. Available at https://explore-education-statistics.service.gov.uk/data-tables/neat-statistics-annual-brief/2025 subject LD equals 85A9E7D8-6E-456B-54DF-08DE5F2B2E91. And the text continues. 676. This review does not argue that the answers are easy or that reform will be painless. It argues something more basic. Continuing as we are is no longer a neutral option. 677. Every year the bill grows. Every year the gap between what this country needs and what it does gets wider. 678. What is no longer credible is to do nothing and hope that economic growth alone will solve the problem. Growth will not absorb young people who have never worked, whose health prevents participation, whose anxiety levels are higher and whose career ladders have become harder to ascend. 679. Nearly 1 million young people are outside education and work. They are not a statistic. They are the sons and daughters of this country. Some were identified as at risk before they could read. The system knew. It watched. It documented. It published reports. It commissioned evaluations. It launched pilots. It let the funding expire, and it moved on. 680. Those young people did not move on. They are still here, still waiting, still paying the price for a country that has chosen, repeatedly and with full knowledge of the consequences, to administer the problem rather than solve it. This review says, enough. Not another program, not another pilot, a system built around participation, accountable for outcomes, permanent in its architecture, with new ladders of opportunity, funded at a level that treats young people as an investment, not a cost, resilient to the problems of tomorrow in a labour market which is likely at the beginning of yet another transformation, and worthy of the generation it is supposed to serve. A new mindset is needed. Our country can choose differently, one that prioritises the next generation. This review demands that it does. This concludes Track 10. Track 11. This track is approximately 16 minutes long. Annex, the benefits landscape. 681. There are a number of benefits that are available to young people. 682. Universal credit, UC, is a means-tested benefit payment which provides help for people with their living costs based on an assessment of their needs. For most, eligibility begins at age 18 and the under 25 standard allowance is £338.58 per month for a single person and £528.34 for a couple. Additional allowances are available for children, housing, caring and incapacity. 683. Universal credit is designed to be an in and out of work benefit. It applies a single taper rate on earnings, reducing payments by 55p for every pound earned. Households with a work-limiting health condition or a dependent child qualify for a work allowance, where the taper rate does not apply. This allowance is £427 per month when claiming housing costs or £710 per month otherwise. Currently, there are 784,000 claimants aged 16 to 24, of whom 606,000 are not in employment. Note 617. People on Universal Credit Statistics, February 2026. DWP stat-explore.dwp.gov.uk. Access 28th of April 2026. Available at https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals UC_monthly. And the text continues. 684. Universal Credit Health is a journey within Universal Credit for people with a work-limiting health condition. Following a Work Capability Assessment, WCA, people are found either fit for work, to have limited capability for work, LCW, or limited capability for work and work-related activity, LCWRA. The LCW group are not required to be available for work or actively seek work, but can be asked to undertake work preparation activity, though they receive no additional payment. The LCWRA group receives an additional payment and have no work-related requirements. Both groups receive a work allowance, which means they can earn up to a certain amount before benefit payments start being reduced. The UC health payment is £217.26 per month, or £50 per week, for new claims from April 2026, on top of the standard allowance, or £429.80 per month, or £98.80 per week, for claims before that date. There are currently 257,000 claimants aged 16 to 24 on the UC health journey. 48,000 waiting for a WCA, 34,000 in the LCW group, and 175,000 in the LCWRA group. Note 618. UC Health Caseload, December 2025. DWP stat-explore.dwp.gov.uk. Access 28th of April 2026. Available at https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals UC_WCA_case. And the text continues. 685. Personal independence payment is a tax-free, non-means-tested benefit designed to help with extra living costs for people aged 16 to state pension age in England and Wales who have a long-term physical or mental health condition or disability. It is assessed through a functional assessment which measures the impact of a long-term health condition or disability on an individual's daily life. It is not an assessment of their ability to work, and payment of the benefit is unrelated to employment status. There are two separate elements, mobility and daily living, both of which have a higher and lower rate. Daily living is paid at a standard rate of £76.70 per week or an enhanced rate of £114.60 per week. Mobility is paid at a standard rate of £30.30 per week or an enhanced rate of £80 per week. There is no associated conditionality. There are currently 430,000 claimants aged 16 to 24 in England and Wales. Note 619. PIP cases with entitlement since 2019, January 2026. DWP stat-explore.dwp.gov.uk. Access 28th of April 2026. Available at https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals pip_monthly_new. And the text continues. Just over a third of PIP recipients are NEET. Note 620. Education and employment status of PIP claimants. Young People and Work Interim Report. Analytical Annex. Available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. Disabled people in Scotland can claim the devolved adult disability payment. 686. Before the age of 16, disabled children are supported through payments to their parents. This includes child benefit, paid at a rate of £27.05 per week for the first child and £17.90 for each subsequent child. Child benefit is a universally available payment but is recovered through a tax charge from people with a taxable annual income of more than £60,000, with people earning £80,000 having the payment fully recovered. Alongside child benefit, means-tested support for low-income families is available for children through universal credit, paid at a rate of £303.94 per month per child, with additional payments for disabled children. Disabled children in England and Wales can also receive Child Disability Living Allowance, Child DLA. This is a non-means-tested payment, consisting of a mobility and daily living amount like PIP, and its total value can range between £30.30 and £194.60 a week. Assessment is based on whether the child needs substantially more care, supervision or mobility support than their peers. Children living in Scotland can claim the devolved child disability payment. For young people aged 16 to 19 in non-advanced full-time education, financial support continues to be paid to the parents through universal credit and child benefit. 16 and 17-year-olds cannot, in most circumstances, claim universal credit in their own right, even if in work. In contrast, disability support moves to PIP and is paid direct to the young person at 16, with the claimant undergoing a reassessment. The employment support landscape. 687. The other arm of the welfare system, sitting alongside benefit payments, is employment support. Young people are supported through various DWP programs to find employment. 210,000 workless young people are in the intensive work search group of Universal Credit and not waiting for work capability assessment. L. Benefit Combinations, August 2025. DWP stat-explore.dwp.gov.uk. Available at https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals UC_monthly. There are also around 50,000 young people in the intensive work search group who are in low-paid part-time work, as universal credit entitlements are income-based and gradually reduce as earnings increase, and around 50,000 who are out of work and waiting for a work capability assessment. And the text continues. Claimants are required to be available for work, to actively seek work, to undertake activities that will help them get into work, and to attend regular face-to-face meetings with a work coach. This is often also matched with high levels of support from Job Centre Plus youth work coaches from the Restart scheme, which supports around 50,000 young people in the IWS group, and through access to training and work experience programs, including sector-based work academies. 688. The government has announced enhanced support for young people looking for work. Through its new Youth Guarantee, it is funding 360 youth hubs that will join up Job Centre Plus support with wider local services, put in place a new gateway with guaranteed support options after 13 weeks of employment, introduce a £3,000 job grant for employers hiring someone who has been unemployed for 6 months, and fund new guaranteed jobs for those unemployed for at least 18 months. 689. For young people on the health journey, which means that they are either waiting for a work capability assessment or have been assessed as having limited capabilities for work and/or work-related activity, the system has little or no requirements and historically has matched this with little or no support. Specifically, in the most recent data, December 2025, 690. 48,000 young people were waiting for a work capability assessment. On average, they are allocated the equivalent of 1 to 2 minutes of work coach time a week, compared with weekly and fortnightly meetings for others in the IWS group. In the vast majority of cases, all work-related requirements are also waived. 691. 34,000 young people have been assessed as having limited capability for work. They receive the same 1 to 2 minutes of work coach time a week on average as the assessment group, and can be required to undertake work-related activities, but not to actively seek work or be available for work. Around 1 in 40 move into work each month. 692. 175,000 young people had been assessed as having limited capability for work and work-related activity. For this group, there are no regular meetings with work coaches at all, and no expectations or requirements for activity or engagement. For this group, around 1 in 100 move into work each month. Note 621. Flows into work from. Into work flow rates by conditionality group. Young People and Work Interim Report, Analytical Annex, available at https://www.gov.uk/government/people-and-work-interim-report. Caseload numbers from UC Health Caseload, December 2025, DWP, stat-explore.dwp.gov.uk, accessed 28th of April 2026, available at https://stat-explore.dwp.gov.uk/webappy/open info page ?ID equals UC_WCA_case. And the text continues. 693. Access to Work provides funding for practical workplace adjustments, specialist equipment, and support for disabled people in employment. It is demand-led, depends on the individuals knowing it exists, and requires a job or job offer before support is triggered. In 2024/25, only 7,400 people aged 16 to 24 received a payment through the scheme. Note 622. 16 to 24-year-olds receiving access to work payments 2024/24. Young People and Work Interim Report Analytical Annex, available at https://www.gov.uk/government/people-and-work-interim-report. And the text continues. 694. The government has also taken steps to enhance specialist support for disabled people and those with health conditions of all ages, in particular through its Pathways to Work offer. This has included the rollout of 695. Connect to Work, a local employment program which in time will provide support to 100,000 people a year. 696. 1,000 new Pathways to Work advisors in job centres, primarily supporting those in the LCWRA group, and already engaging over 65,000 people. And 697. Work Well, bringing together health and employment services locally to provide health-led early help to support people to enter or return to work. This concludes track 11 and brings us to the end of the whole communication.